Alright, good morning and Assalamualaikum everybody. Let's begin our event today with Ummul Kitab Al-Fatihah. Amin Ya Rabbal Alamin. Thank you for making the time to attend UMMC's International Day for Older Persons 2022 celebration hosted by the Geriatric Medicine Unit with the generous support from Bayer. I am Wan Safia Nur Najah.
And I'm Chamin Hooi, and we're the MCs for today's event. To start our event today, we would like to invite UMMC's consultant geriatrician, Associate Prof. Dr. Chin Iron, to deliver his welcoming speech. Welcome, Prof. Chin.
Thank you very much. A very good morning to everyone. I'm Professor Dr. Chin Ivan, and I'm the current head of geriatric medicine in University Malaya Medical Center. I'm a senior consultant geriatrician here. A very warm welcome to everyone here and those viewing online to our public awareness talks. And this is part of our ongoing celebrations for the International Day of Older Persons. For those here in person, please do visit some of the 22 booths dotted around the UMMC Plaza. For the public, these booths, or most of them, will still be around until tomorrow, so you can still visit them if you like. We have a nurses symposium tomorrow, focusing on the challenges faced by nurses looking after older persons, particularly in a hospital or healthcare facility. And in addition, for those caring for older persons in the community, there will be a caregivers workshop next week on the 19th. This is a workshop our unit has been running for over 15 years. And if you haven't signed up for it, please do so as soon as you can. The last time we held this workshop face-to-face before the pandemic, we had nearly 200 participants. And we had to, unfortunately, turn away some people because we had run out of room. So please do sign up if you haven't. The United Nations General Assembly has declared this decade the United Nations Decade of Healthy Aging. As such, the topics chosen for this public forum today reflect the need to remain as healthy as possible as we age, and range from diet to physical health and oral health to keeping safe and avoiding financial scams. I hope that you will find these talks informative. And that they will help you keep physically, emotionally, cognitively, and financially well. I would like to thank each and every one of the speakers, as well as my organizing team led by Associate Professor Dr. Tan Kitman, and Dr. Terence Ong, Sister Madya, Sister Mimi, Puan Fazila, Puan Hazlizan, as well as all the rest of our very dedicated geriatrics team, our doctors, nurses, allied health professionals, and support staff. I would also like to thank our Pengara, Professor Naziria, as well as Professor April, our Dean of Medicine, for the continued support for geriatric medicine in University Malaya. In addition, I would also like to thank Bayer for their generosity and the support for public education to improve health. Lastly but not least, I would like to once again thank all of you for joining us today here and online. We start to age the moment we are born. It's never too early or too late to find out how to age healthily. Thank you.
Thank you very much, Prof. Chin, Senior Consultant Geriatrician, Head of Geriatric Medicine Unit. So it has been predicted that by 2040, the older population will increase by 14.5%. Malaysians are definitely living longer, but are we aging healthily? Today, we will discuss aspects that revolve around achieving healthy aging. You are what you eat. The first aspect of healthy aging that we will explore today revolves around what we put on our plate and how it affects us. So our first speaker is UMMC's very own dietitian with almost a decade's worth of experience working in his field. Without further ado, we would like to invite Mr. Mok Chu Zhen to give his talk on eating well, aging well.
Thank you for the introduction. Can you see my slide? Can see me only. Can you switch to the slide? Okay, that's good. Okay, good morning everyone. My name is Mok Susan. I'm a clinical dietitian from UMMC. So I'm really glad that today I get to meet with you all in person. It has been a long time that we have to meet over the internet, through the online conference. So now we can meet in person so we can discuss a little bit about healthy eating, especially for older person. I also wanted to say hi to the audience who are watching online. I hope that next year you can join us in the venue. Okay, the topic given to me is eating well, aging well. So what is actually aging? So when we are born, we grow up. After we grow up, we started to grow old. Is it very sad? Not necessary. Because most of the time, when people think about getting old, negative thought about it, they would think that, oh, I might not be able to walk, I might not be able to eat our own food, I might not be able to stand, I have to be bedbound. So now, when we are growing older, and Malaysia has become an older population now, so okay, so one of the issue that we commonly see is malnutrition. So what mind when we talk about malnutrition? It is always very slim, very thin, and then they are lying on the bed. It is not necessary. Malnutrition is actually a state of nutrition. It can be either overnutrition or undernutrition. So it is not necessary someone is very thin, then they are considered malnourished. Okay? The changes in the body composition will actually reduce or diminish the functionality of the body. Okay, so as you can see from the picture A and picture B. So what do you think? Most people would think that picture A is actually malnutrition, but in fact, for people at picture B can be also malnourished, because even though they have big body size, but doesn't mean that they have good body health. They can be high in body fat, but at the same time, they have low lean muscle mass. And lean muscle mass is very important for older person. Okay, so how do we know whether we are healthy or whether we have healthy body weight? Most of the time, I think everyone knows how to calculate your BMI. You can simply divide your body weight in kilogram by your height in meter for 2 times. So you get a figure. For example, my body weight is 58 kg. My height is 1.62 meter. So I just divide my with the height 2 times. My BMI is 22. So I'm a 34 years old man. BMI of 22, is it considered healthy? Yes. Okay. For younger adult, BMI of 18.5 to 24.9 is considered healthy. But this is no longer the case for older person who age more than 65 years old and above. Most of the time, we recommend our older person to not be too slim. That is why the healthy range for BMI for older person is 23 to 30. Okay, so it is a little bit different from what we usually think about. Okay, reason is, when we look at the research, it actually shows that for older person with BMI lesser than 23, the chances to have osteoporosis, the chances to have falling, okay, is much higher compared to those who have BMI more than 23. That is why we wanted to make sure that our older person is not going to be too lean. Okay, but if the BMI is more than 30, probably we need to look into the diet, look into the physical activity to see whether we have the needs to reduce the body weight or not. Okay, so apart from the BMI, there is another easy way for us to identify the risk of malnutrition for older person. So what you can do is, you can ask your parents, your grandparents to sit down on a chair, make sure that the knee is bent 90 degrees, ask them to use the fingers, okay? This is our thumb and our index finger form a finger ring. This is called Yubiwaka. So when we are sitting down, form the finger ring at the biggest circumference of our cuff. Semua orang boleh cuba. You can try on your own. Okay. So if it is ngam-ngam, it is tightly fit. It is ngam-ngam, it is tightly fit. or it is bigger, the ring, or it is bigger, the ring is bigger than your calf, meaning that you have low risk of malnutrition. It's bigger than your calf, meaning that you have low risk of malnutrition in terms of undernutrition, But if the finger ring is smaller, the calf is smaller than the finger ring, meaning that you have higher risk of undernutrition. So for older person, you can use an easy way to identify the risk of undernutrition. Okay, if you have risk of undernutrition, please consult your doctor or dietitian for further investigation. Okay, so what is actually causing the issue of malnutrition or undernutrition for older person? When we are growing older, there are changes in our body function. For example, older person produce lesser saliva, and saliva is the important medium for us to taste the food. Without the saliva, our taste bud cannot sense the food. Without the saliva, all the food become hard. They are not digested well. Our digestion started from the mouth, not from the stomach. So that's why older person, they tend to have poor appetite because they don't feel the food is tasty. Another possible issue is they might have issue with the dentition. They might have loss of teeth, they might have caries, the infection of the gum, so they feel painful, they cannot chew properly, they cannot eat properly. Okay, so another possible issue is when someone is growing older and they are losing their muscle mass, losing their body weight, at the same time their cheekbone and also the muscle of the mouth, of the oral, the facial muscle, and also the gum is shrinking. So if they are wearing denture, they might not be fitting well. So when you ask an older person, sometimes they will say, when they want to eat, they will take out the denture. The denture is actually for aesthetic purpose. They just put it on so that they look good, but it doesn't serve any purpose. So that's why we always recommend our older person to have regular checkup with the dentist to see is there any changes and is there any needs that we need to adjust the denture or make a new set of denture. Okay, at the same time, some older person, they have reduced mobility. Maybe they have osteoarthritis, they have knee pain, they cannot walk. They have to rely on someone to serve the food to them. So for example, a lot of older persons, they live with their offspring, they live with their grandchildren and children who are working or go to the school during the daytime. So during lunch hour, they have no one to serve them food. So they might just drink water or skip the lunch. In the end, they are getting lesser and lesser nutrition. Okay, so some disease, for example, stroke, dementia, or Parkinson disease, all these diseases actually limit the function of the hands so that they cannot scoop, they cannot feed themselves. So these are all the possible reasons why an older person can get undernutrition. Okay, so let me share with you one of the case that I actually worked on before. This is a lady. She told me what she has been eating for the past 3 months. This is very common, right? Early in the morning, they have 2 slices of bread. This lady told me, people said, whole grain bread, wholemeal bread is healthy, so I eat wholemeal bread. But in fact, she doesn't like it. Okay? So she would dip with the black coffee. This is very typical. And then lunch hour, no one at home, so she would just simply cook instant noodle. Okay? So that is a typical lunch. Dinner, when everyone is coming back, she feel very tired, exhausted. So the family prepare porridge for this lady. So do you think this is healthy eating for older person? Definitely no. So it is very difficult for us to force our older person, our senior citizen to eat more. We can't simply tell our patient that, oh, you should eat more, then send them off. Because they don't have the appetite. They feel full very easily. So we need to help them to identify the possible issue that can cause the poor appetite, so that we can help them to improve their appetite by increasing the calorie and protein intake. Let's see. If they are not having good appetite, no point asking them to eat more. We in fact can ask them to take a small snack in between the meals to increase the calorie and protein intake, so that they don't have to eat a large portion of food at one go. Okay? So what are the possible choices? There are a lot of choices of snacking that can be provided to older person. For example, fruit is always the best option for the snacking. But some of them, they don't have teeth. So they said they cannot chew the food. So what did they do? You can blend the fruit or you just puree the fruit. But remember, please do not filter up the fruit juice. When you filter it up, it will be just like taking out most of the nutrient. Take it with the puree, so it will give you more fiber in it. You can prepare a coffee or tea with milk. So please don't be so stressful that you must eat healthily, in the sense that you cannot eat fat, you cannot have oil. So if older person with issue with malnutrition or undernutrition, you can always go for full cream milk, so that you get a little bit more calorie. At the same time, you can enjoy your coffee and tea. Okay, so other good choices of snacking like kuih muih, cake, that is easily available in Malaysia. Yogurt, okay, milk is also a good choice for our snacking. Okay, so there are so many types of snacking that you can provide to older person. Even though you just follow one type of them, it is not going to be repetitive for the whole week. Okay, so if they have good dentition, try to incorporate nuts consumption into the diet at least twice a week. With a handful of nuts, it can reduce the risk of cognitive impairment, okay, by 21%. Okay, with condition that particular older person can chew and swallow properly. Okay, so I give some example of soft texture fiber food source, because a lot of older person, they have issue with passing motion. They have constipation. So constipation can be multifactorial. It can be because of lacking of fiber intake, lacking of fluid intake. At the same time, when you are growing older, your muscle is weakened. So the intestine is not pushing your food well. That is why you have issue with the constipation. So when they say they cannot chew, some patients, they will just chew and spit it out. So what we can do is we provide soft type of vegetable. For the leafy types of vegetable, we just provide the leaf only, take out the stem. Okay, for starchy vegetable, which is a good source of calorie and fiber, you can simply steam or cook, mix with some milk, mix with some herbs. For the carrots, pumpkin, potato, so it will be a good source of fiber. Okay, for fruit wise, get the softer texture of fruit like pear, papaya, honeydew, banana, mango. There are so many types of fruit can be provided to older person. It is not always apple. Nowadays, we are not talking about one apple keeps the doctors away. We don't want to say that, because we want to see our doctor regularly to make sure that we are healthy enough. Okay, so it is not only for older person, for younger person also is the same. We wanted to have at least 3 servings of vegetable and 2 servings of fruit every day. That is a minimum requirement so that we can get enough fiber in our diet. Okay, so we are talking about fiber. Please do not forget about fluid. Older person tends to drink lesser compared to younger time. That is because they have reduced thirst sensation. In their body, in their mouth, they don't feel thirsty. So that's why they don't drink. And some older person, they have difficulty to go to toilet. They need help to go to toilet, or they might be wearing diapers at home. So they don't want to drink that much of water that can cause them to go to toilet very frequently. But this is not really good. So how much an older person needs? Okay, an older person requires about 25 to 30 ml of fluid for every 1 kilogram of body weight. So for example, if someone is having 60 kg, the requirement will be about 1,500 ml to 1,800 ml. Okay, so you can actually ask your parents and grandparents at home to have enough water by providing them a bottle of water. So by the end of the day, when you go back home from work, check whether they finished the bottle of water or not. Okay, but not to forget other fluid, from fruit juice, from milk, even from coffee or tea. They're also a good source of liquid. Okay, so let's see how what is actually wrong with this particular meal. Is actually they are lacking of protein. Okay, so if you look at the breakfast, it is carbohydrate from the bread. The lunch is the noodles, and then the dinner is the porridge with a little bit of chicken. That is definitely not enough. Okay, so from this diet, the particular patient is getting about 400 over calorie with less than 30 grams of the protein. For your information, an older person require at least 1,500 to 1,800 calorie, 50 to 60 grams of protein. So after 3 months of eating like this, definitely they will be losing weight. Okay, so when they say they cannot chew well, cannot eat the meat, what we can do? We can actually choose the tender part of the meat or the poultry. For example, if you are buying for beef, get the tenderloin part of the beef, or we call it batang pinang. Okay, it is softer, so when you cook, make sure that you fully cook it, but don't make it until very tough. Okay, or you can choose fish, make sure that you take out all the prick. Okay, or you can actually cut the meat or into cube or mince the meat so that they can be easily scooped. Otherwise, the moment they finish cutting the meat, they feel tired already. Okay, but when you cut the meat, actually you will actually dry up the meat when you cook it. So what you can do is you can actually cook the meat first, then only you cut it later. Or you can marinate the meat. For example, if you mince the meat, you can add in a little bit of the cornstarch, a little bit of egg white, so that when it cook, the cornstarch and the egg white will form an isolation layer that will help to maintain the moisture in the meat so that it wouldn't be chewy. Okay, we also have a lot of different types of the soft texture protein like egg. Don't be afraid of taking eggs. The dietary cholesterol in the egg doesn't increase the cholesterol in your blood. It is always the fatty acid or the fat that we use to cook our egg that can increase your cholesterol. So egg yolk is definitely good to take, okay, because we have a lot of nutrient inside. Tofu or dal, they are good source of soft texture protein. Okay, so how much do they need to take? For an easy way, just look at your palm, okay. So for every older person, they should be taking 1 servings of protein for every meal, and that particular serving is about 1 palm size. It is similar to 2 matchbox size of the fish or chicken or meat. That is very easy. Just let them look at the palm so they will know whether they are eating enough or not. Okay, let's see how we can actually increase the calorie and protein intake for this particular lady. Instead of taking less than 500 calorie, instead of asking them increase the amount of bread, we can actually put some spread onto the bread to increase the calorie, like fruit jam, peanut butter, which is a good source of protein. You can even add some fruit on top of it. Okay, so you increase the fiber, you increase the calorie. Okay, at the same time, don't prepare the black coffee only. Try to prepare the coffee with full cream milk. Okay, for lunch, instead of taking plain porridge, you can add in some chicken pieces to increase the protein. For dinner, maybe they really don't have appetite, they wanted to take porridge, then you can put in extra protein like tofu, put in some fiber like pumpkin, and before serving the porridge to the older person, you can add in maybe 1 or 2 teaspoons of the cooking oil, olive oil, or even sesame oil to increase the flavor and increase the calorie. By just changing a little bit of the diet, actually it has increased almost 1,000 calories, but it is still far from enough. So you can always recommend them to take small snacking in between. So with this diet changes, modification, this particular patient can actually increase the calorie intake to more than 1,600 calories, and the protein is almost 80 grams. So this is a lot. But it is impossible for someone to, fulfill everything. So take one step at a time. So maybe just increase a little bit at one time. Slowly, when their appetite getting better, they eat more, they will have even better appetites. So aging is not something that we can resist, but while we are living longer, we wanted to have healthy mind and healthy body. So please make sure that an older person is maintaining a healthy body weight at a BMI of 23 to 30. Okay, adopting the balanced diet. Okay, eating healthily so that you get nutrients that can sustain your body. Engage in exercise. It is very important to have exercise. Otherwise, no matter how much that you eat, it wouldn't be utilized well. Okay, so seek help when it is needed. If you show any abnormality or sign and symptoms, check it with the doctors or the dietitian so that we will know what happened to you and how we can help you. Okay, so I think that's all for my talk. So just a disclaimer, whatever that I discussed today is a general advice of older person. If anyone has issue with heart, liver or kidney disease, please consult your doctor and your dietitian for individualized diet plan. Thank you.
Thank you, Mr. Mok. That's definitely food for thought. We'll now open the floor for questions. If there are no questions, okay, come, welcome.
For this, how do we manage the weight slowly to reduce the weight?
Okay, in terms of weight reduction, so what we do is we look into your dietary intake first. Okay, we try to identify how much calorie and protein you have been taking. So slowly we can actually cut down certain foods or drinks that you have been taking. It can cause a calorie deficit. So we reduce in the calorie and you increase in the physical activity to burn extra calorie. By that way, you can reduce your body weight. So very simple. So some patients, they have drink every day. So probably they have teh tarik 3 times a day. Simply by cutting down the teh tarik to 1 time a day, you can actually reduce 400 calorie. So just looking at your diet, you can actually understand what happened and how we can actually cut down your calorie. Okay, there is no limit for the egg consumption in our current dietary guideline. As I say, dietary cholesterol doesn't increase the cholesterol in the blood. Okay, our cholesterol, 80% of our cholesterol is actually produced by our liver, especially at night. So that's why when doctor asks you to eat the cholesterol medicine, they ask you to take it at night. Okay, so what actually to be used to produce the cholesterol is actually the saturated fatty acid and trans fatty acid. Saturated fatty acid usually comes from the animal fat, okay, or it comes from coconut milk, okay, or it comes from milk fat. So there are a lot of sources of fatty acid that can contribute to the cholesterol. It is not because of the egg. But at the same time, we don't recommend someone to take too much of egg in 1 day or 1 week because we don't want someone to have repetitive same source of food. We want our food to be in more variety types so that we get different nutrients in different types of food. Okay, there is no limitation there.
Is it true that for the dessert of fruits should be taken before meal is better than after meal?
Okay, actually, there is no certain way that you must eat the fruit before or after. It depends on individual and it depends on the needs. For example, there is some patient, they have diabetes or they have issue with eating too large portion of food. So I normally will ask the patient to eat fruit before the meal, maybe like 15 to 20 minutes before the meal. So that when you eat the fruit, you feel full, you're not going to eat too much of the food later. But for some patients, they can finish 1 kilo of grapes at one go. So if there is a case, I will ask that particular person to eat the fruit after the meal because you have finished eating the fruit. You feel full, you're not going to overeat the fruit. So that's the way. There is no certain way that you must eat before or after.
Thank you, Mr. Mo, again for the great advice. Ladies and gentlemen, do you know that with increasing age, the heart has a higher risk of having irregular rhythm? To further expand on this topic, we would like to call upon Associate Prof. Dr. Tan Kit Man to deliver her talk entitled Atrial Fibrillation in Older People. Why do I need to screen for it? Prof. Tan is a consultant geriatrician here in UMMC with multiple publications on this topic. Today, we are honored to have her to share with us her expertise. Welcome, Prof. Tan.
Thank you very much, MC, for the kind introduction. And there are my slides. Very good. Very good to see everybody here today and also online. Thank you for attending. And thank you very much earlier on to Prof. Dr. Chin Ivan, our head of department, head of division of geriatric medicine, for giving the welcoming speech. So without further ado, this is my topic today. So let's start from the basics. What organ of the body does atrial fibrillation or AF affect? After this, we'll refer to it as AF for short form. It affects the heart. And then on the left side, you can see the outside structure of the heart with the big blood vessels coming out of it, and then the small blood vessels that supply the muscles of the heart. But let's see a cross-section of the heart. If we cut it open, it has 4 chambers. And the upper chambers, the smaller ones, are called the atrium, and the bigger chambers at the bottom are called the ventricle. The left side of the heart, the right side of the heart, blue color, has blood that has less oxygen. So it will pump the blood to the lung. In the lung, the blood gets oxygen, comes back to the left side of the heart, and then the left side of the heart pumps blood through the whole body. It's a very important organ, the heart. We need it to survive. Now, what is atrial fibrillation? Usually, the heart beats in a regular rhythm. And you can see then the first ECG at the top right there, that every beat is approximately evenly spaced. So this is called sinus rhythm. And it's usually like this in a regular, normal, healthy person. Then, if the heart beats irregularly, then it's called atrial fibrillation. I'll explain where it starts later in the heart. It is a common type of cardiac arrhythmia or heart arrhythmia. And it's the commonest type of heart arrhythmia in older persons. The second ECG here shows that it's irregular. Compare this to the top. I wonder, can you see the cursor? Let's go back one. Backspace. Oh, there we go. Yeah, it's irregular compared to the regular rhythm at the top. There are also other causes of transient irregular heartbeat. Extra beats called ectopics, they are usually of no harm, and then other rarer causes. So the best thing is, if you feel your heartbeat irregular, go and check with a doctor properly. We can't diagnose atrial fibrillation by ourselves or other types of arrhythmia. So what happens in the heart in AF? It's a heart arrhythmia. In a normal heart, there is the what we call the sinus node, where the electrical impulse originates. Then it will go very systematically from there down to the other AV node, and then the electrical impulse will travel very evenly to the left and right side of the heart, big heart chamber. So your heart will beat quite well and compress very regularly. But in atrial fibrillation, in the smaller chambers of the heart, there are multiple focus of these electrical impulses instead of just one. Everybody is shouting out a little bit. So the electrical impulse will travel down irregularly, and then the heart will not beat in such a synchronized manner. It will be a bit wobbly or be beating in an irregular manner. So when we pump the blood out of the heart, we might not pump it so effectively. Yeah? So it's a pump. It's a pump. The heart is a pump. And if it's an irregular rhythm, it won't pump so well. How common is AF in older persons? You can see that it increases with age. The age is down here, 50 years old all the way to more than 90 years old. And atrial fibrillation AF is more common with age. These are in percentages. So how does it translate to layperson's terms? It's approximately 1 in 7 to 8 older people aged 80 and above, or 1 in 9 older people aged 75 to 79, for example, or 1 in 13 aged 70 to 74, or 1 in 20 aged 65 to 69. These are approximate figures. As we grow older, it's more common. So our grandfather, who is like in the 80s, more likely to have atrial fibrillation than, let's say, our uncle who's in their 60s. What are the risk factors to develop AF? It'll be older age group, long-term poor control of high blood pressure because your heart will be pumping against a high blood pressure, coronary artery disease, which is like blocked blood vessels in the small blood vessels that supply the muscle of the heart. So if someone get heart attack, the smaller blood vessels in the first picture, they're the ones that get blocked. Or heart valve disease. Inside 4 chambers of our heart, there are gates or valves. If there's problem with the valve, if it's leaky or too narrow, then it can also cause a problem. Sleep apnea is a condition where when a person sleeps at night, their breathing pattern is rather irregular. And sometimes they may even stop breathing for 20-30 seconds. And they also tend to snore, may have a higher body weight, and in the daytime, in the afternoon, they might fall asleep easily. Yeah? So sleep apnea is a condition that can be diagnosed if the person wears a oximeter or a monitor at night to see how low the oxygen level goes when they are sleeping and how often. So untreated sleep apnea in the long term also can increase the risk of AF. Any severe new illness like an infection or heart attack or major surgery, any severe illness, a person's admitted to hospital, they can also develop atrial fibrillation. It may go away when the condition is treated, it may not. Excessive alcohol. If a person drinks excessively, many units or drinks of alcohol at once, they also can have a sudden attack of atrial fibrillation. Long-term obesity, because again the heart has to beat against a large body weight and it can get quite stressed. Untreated overactive thyroid, that's another reason that can cause AF. And people in general, if they have many other health conditions like poorly controlled diabetes or kidney disease, they may also develop AF later on. Okay. Now, what are the symptoms of AF? A person may feel or be conscious of their heartbeat, like palpitations or the heart fluttering. Not everyone will get all the symptoms. They may get a few of the symptoms, or they may not get any significant symptoms at all. They may get chest pain transiently if the heart rate beats very fast. They may be dizzy or lightheaded, can feel tired or weak, or short of breath. They may also have reduced exercise tolerance or get quite breathless when they try and walk fast. Now, of course, low physical activity in the long run also can cause us to have these symptoms. So if you're worried, please do have a check with your doctor. Is the AF there all the time? It may be there all the time. Then it's called either persistent, chronic, or permanent. But it can also come and go. Then it's called paroxysmal or intermittent. Both types also require treatment and monitoring by a doctor. And what are the consequences of AF? A blood clot can develop in the upper chamber of the heart, left atrium. And I'll show a picture later, because a picture is worth 1,000 words, isn't it? The blood clot from the chamber of the heart, the small chamber of the heart, can travel to the bigger chamber and then the major blood vessels. Theoretically, it can travel to any organ in the body, but it most commonly goes to the brain and it can cause a stroke. We'll talk about the symptoms of a stroke later. If it travels to the lower limbs, it can cause gangrene as well. And then you end up with black toes or black gangrenous lower limb or leg. If the clot travels to the intestines, the bowel wall can become lack of blood supply and there'll be death of the intestinal tissue. That's why it's so important to pick up AF and to treat it. Now, this is a picture to show that the clot will develop in the smaller chamber of the heart, and then it can travel down and then travel to the major blood vessels and somehow make its way up to the brain. And then when it blocks blood vessels in the brain tissue dies, and that's how we get a stroke with atrial fibrillation. What are the signs and symptoms of a stroke? There's a fast public awareness campaign in the UK and now around the world as well. It means if you suddenly see somebody's face go weak on one side, the arm or leg go weak on one side, there's slurred speech or inability to speak properly, then it's time to very quickly call 999 and rapid transfer to hospital. The person can benefit from acute treatment. We don't have the attitude of let's wait and see at home, because once the damage is done, the brain tissue dies, we cannot revive the brain tissues in general. However, if you get to hospital early enough, the brain tissue hasn't fully died. There may be some type of treatment that the doctor can give to take away the clot. It could be an injection or it could be a physical procedure to pull out the clot. That physical procedure to pull out the clot is only available in some specialist hospitals. But the bottom line is, if you suspect a family member or a loved one has stroke, quickly rush them to the closest hospital. Don't wait at home to see what will happen. A stroke is usually sudden onset symptoms. If the symptom is gradually over the last few weeks or months, it's not so likely to be a stroke, but do see a doctor about it. Other less typical symptoms, the person could have poor balance, loss of vision, loss of feeling or sensation, difficulty with swallowing their food, or change in behavior or personality. There are actually many symptoms of stroke. We're just naming some of the more common ones here. Stroke is really a life-changing event. What we call cardioembolic stroke means the stroke that comes from AF and the blood clot in the heart travels to the brain. They are usually larger and more debilitating than other types of stroke where the person didn't have AF. They might just have high blood pressure and diabetes. They can also cause big strokes, of course, but someone with AF can cause an even bigger stroke. So in a split second, a person can become instantly frail. They're doing okay, they can drive around, interact with their family members. Then after the big stroke, they become dependent on others. So that's why it's so important to screen for AF and also look for other risk factors for stroke, like high blood pressure, diabetes, high cholesterol, stop smoking, treat heart attacks and everything. What are the chances of getting a stroke with AF? The risk of getting a stroke ranges from 1 in 70 over persons with AF per year to 1 in 7 per year. So you can see it's quite a wide range. I'll explain later why some people more likely to get stroke, some are less likely, but they're all at risk of stroke. Once you have AF, you're at risk of stroke. It depends on the presence of other risk factors. The more risk factors, the higher the risk, like older age, high blood pressure, heart failure, female gender, previous stroke, diabetes, had a heart attack before, or blocked blood vessels in the legs. That's called peripheral vascular disease. The doctor may sometimes take out this chart and see whether how many of these risk factors you have. And the higher number of risk factors, the higher risk of stroke. So let's say someone is unlucky enough to have all 9 points. Their risk of stroke per year is 15%. This is about 1 in 7. But they only have these one risk factor, one of the many risk factors. Their risk of stroke per year, 1.3%. That's the 1 in 77 people who have only one risk factor. So it's a broad range. No matter how low or how high the risk factor is, someone with AF should seek medical attention, talk to your doctor about how to manage it in the long run. How is AF diagnosed? There may be what we call opportunistic pulse palpation, or if the person has some of those symptoms and went to see the doctor. We cannot diagnose AF just by feeling the pulse. We actually need to do further tests to confirm. And a simple one would be an ECG. It takes a few minutes to do, and we can see whether the rhythm is regular or irregular, like the first a few slides I showed. Then if the doctor is worried that it's not there all the time, he'd really like to pick it up, he might order something called a 24-hour Holter monitor. But sometimes, even though a person has AF, the Holter monitor may not pick it up because it's only for 24 hours. Then the doctor may repeat the Holter monitor a few times. In some specialist centers, they may recommend implanting a loop recorder. That is not only to pick up AF, but other reasons of cardiac arrhythmia that might cause a person to black out. Of course, that's very expensive, and it can stay in for many months, but it can pick up different types of arrhythmia, not only AF. Now they have a little simple device. One of the brand names is called Easy Pro, but there are so many other brands out there. It is quite small and it's just worn at the top of your chest with a very good plaster. It can stay on for 14 days, it's water resistant, and it can then analyze for 14 days. After the person takes it off, it will be taken to the technician's laboratory. They will run all the rhythm and show the doctor whether there's any irregular rhythm there. Then nowadays also the smart watches, it can detect irregular heart rate sometimes. But it's not fully diagnostic. It might tell you, the person, that your heart rate is a bit irregular. Do go to the doctor to have a checkup. And the doctor will then formally organize, like perhaps the ECG or Holter monitor, or refer to a cardiologist who's the heart specialist who deals with these conditions. What is the treatment of AF? Usually there may be, we need to control the heart rate. We can't let it go very fast, like 90-something, 100 all the time. The heart will get very tired. And there are different types of medicines that can control the heart rate. Depending on what the person tolerates, the target might be heart rate of about 70s or high 60s. Your doctor will adjust it for you. And the names of the medicines are like beta blockers, like atenolol, bisoprolol, and calcium channel blockers, or digoxin. Again, we cannot buy these over the counter. We need a doctor to prescribe it. For those whose heart rate sometimes goes extremely slow, then it goes fast, sometimes the pacemaker needs to be put in. It's a little device here on the chest x-ray. So when the heart is too slow, the pacemaker will stimulate a heartbeat. Then the heart will beat when there's no natural heartbeat. And it works quite well. And it's not a major operation at all. So don't be too frightened if the doctor says you may need a pacemaker. Of course, the cost is a bit high, but don't be too frightened. It's not major surgery, and people do so well if they had a pacemaker. Then once the pacemaker is there, when the heart is too slow, the pacemaker kick in, then there could be a medicine to keep the heart rate from beating too fast then after that. There's also control of heart rhythm. This is less common. It's more frequently used in younger patients. Means they try and switch back the irregular heart rate to the regular rhythm. And some medicines might be flecainide, dronedarone, but they do have a certain level of side effects. Then there could be procedures as well, like cardioversion, a small electric shock to the heart. The person is sedated to try and shock it back into a normal rhythm from the irregular rhythm. And again, don't feel frightened if your doctor says that, because it's under a very controlled situation. You'll be made very comfortable, and it's considered a minor procedure, not major operation at all. Then there are other procedures like ablation, means they try to burn off the extra focus where the AF starts. So these are very specialized procedures that if your doctor feels you need them, may refer you to a specialist. Now, how do we prevent stroke in AF? I've spoken about treating the AF, but now we want to prevent stroke in AF. Usually there are medications to be given. It's anticoagulants is the proper name, and the layperson might call it blood thinners. Traditionally, there's something called warfarin. It's very low cost, it's cheap and cheerful medicine, but needs frequent monitoring of the blood, a blood test called INR, every 3 or 4 weeks. But now there are more modern medicines called NOACs, and the names of them are like apixaban, dabigatran, which are twice a day, rivaroxaban and edoxaban, which are once a day. They're all very good medicines. They cost more, but you can discuss with your doctor whether what are the risk-benefit ratio. Most people, we try to put on the more modern medicine now. They are more expensive. It does not need the regular INR monitoring for warfarin, but we do need to monitor other blood tests like your full blood count, kidney and liver blood tests every 4 to 6 months, sometimes 2 to 3 months if the person is a bit more frail. The fitter ones may be 4 to 6 months. The side effects of those medicines are potential bleeding. Not everyone will bleed. We just have to counsel the family members and patient what to look out for. So the doctor will choose the most suitable medicine after checking the patient. Any kidney problems, liver problems, swallow problems, other medicines that can cause bleeding. If there are, maybe we reduce those medicines. What's their body weight? and preference for once or twice a day medicines. So, going on these medicines, it reduces the risk of stroke by 2/3. What about people who cannot tolerate those blood thinners? There's a procedure called left atrial appendage occluder. It's this little device there. We rarely use it. It's very expensive and again needs highly specialized expertise. We put it in the little corner of this left atrium where most of the blood clots might appear, might develop, and then hopefully the risk of having a blood clot in that chamber of the heart is less and less risk of getting a stroke. It still needs a short period of blood thinners after putting it in, but not lifelong, usually. So, in summary, AF is common in the older person. It's the commonest heart arrhythmia or irregular rhythm in the older person. Let's say about 1 in 7 or 8 of those age 18 above have it, and between 1 in 10 to 20 of those aged between 65 to 79. So the older we are, the more likely we are to have AF. People with AF has a higher risk of bigger and more severe strokes compared to people without AF. So it's worthwhile to screen for it and to treat to prevent stroke and symptoms, and visit your doctor if you're concerned you have AF. Okay. Thank you very much. I'm quite happy to take questions if there are any.
Thank you very much, Prof. Tan. I think we have time for 2 questions from the floor.
Hi, good morning, sir. Oh, they are very similar. The atrial flutter tends to be a little bit more regular when you feel it, but it's also originating in the atrium of the heart. But the consequences of atrial flutter and atrial fibrillation can be very similar in terms of symptoms and also risk for stroke. So both also need treatment, and your doctor can advise you on which are the types of medicines that are suitable, the blood thinner and also whether to control the heart rate or the heart rhythm. Yeah. So they both can cause an increased risk of stroke. Both need treatment. In Bahasa. It might be atrial fibrillation, but I'm not 100% sure. But it's an irregular heart rhythm. Yeah. Denyutan jantung yang tak seirama. It's a mouthful, but I think atrial fibrillation might be the direct translation. Thank you for the question. Yeah. Oh, no more questions? Thank you very much for coming. Lovely to see everyone. Bye.
Thank you very much, Prof. Tan, for the insightful talk and for the clarification on the questions raised. So another aspect that should be given due attention as we grow older is oral health. Something as simple as poor dentition can actually lead to a myriad of other conditions, including poor nutrition. So today, to advise us on this is Associate Professor Dr. Jacob John from Department of Restorative Dentistry, who will enlighten us on maintaining good oral health into old age.
Oh, you want me to use that also? No problem. Just use that. No problem, no problem.
You can announce your giveaway at the start as well.
Good morning, everyone. I'm Jacob, and I bring greetings from the Faculty of Dentistry. We are just across, very much part of the health family, And I also bring with me some good news. I have a few small boxes here. Okay, I hope it'll excite you a little bit, because I was excited when I got this. Okay, here, something like this, and can you hear the sound? And it goes on to do the business. Okay, those who get your gifts later, I will give you a demonstration. The others can watch probably. Okay, so a very good morning to everyone, and thank you to the organizers for arranging this event and also inviting us from the dental fraternity to join you, as well as to share some information. I'm sure you're all aware of it. Emphasis on some things that probably will help us as we grow in our life. Now, you've heard already two speakers. Okay, you've heard about diet, you've heard about heart. I would say mouth is the entry point to all this, right? Will you all agree with me? Okay, so it is important, but sometimes, somewhere along the way, we feel that the teeth, I have 32 teeth when I started, I lose 1, 2, 3, 4, take sala, right? And then as we go along, that number keeps increasing. There comes a day when there are no more there inside the mouth, take sala, because we have other parts of our body to worry about. Oral cavity probably is, I can still swallow something, I can still speak, I can still drink my water, so what is the problem, right? That's the normal feeling that almost all of us have, okay? So oral health is important or not, we have to decide, okay? It is a healthy mouth is important for a healthy body as well as a healthy mind. And as I mentioned just now, it's the port of entry into our whole body system, for that matter. So tooth decay, tooth loss, gum disease, dry mouth, oral cancer, these are all the common terms that you would hear when you're relating yourself to the oral cavity. We will look at them one by one in a little while. And these are all experienced as we all age. Okay, it is not necessary that we have to become old to experience it. Okay, even in our younger days, we would have started experiencing it when some of us would have neglected it, and it compounds to a bigger risk in the future. So these diseases do not have to be part of our aging process. Okay, that is what is most important, and I hope I can leave that message with you to realize that we can take care of our teeth throughout our life, and we can live with our teeth even to our last day. Okay, so you can enjoy good oral health at any age. I told you about some of the conditions just now, so I'll just highlight them. Okay, so what are they? One is this darkening of teeth. You can see the picture there. Okay, so what you see is it is caused by the dentin. Now, if you go back to what we learned in school, okay, your teeth has got an enamel, a dentin, pulp, cementum, okay, talupaya. So those are all the structures of the tooth. So the outer layer is the enamel layer. The one inside that is dentin. The dentin is a little more yellowish. So that is why as we grow older, we see that our teeth tends to become more yellowish, darker tint. Okay, that's when physiologically you are losing out the enamel structure. As it wears out, you see more of the dentin. It also is, for us Asians, we all have all the spices, right? Baba's spices. So we have spices in our food, and that can also cause darkening. Okay, that's an external factor that causes the darkening. Okay, but there are these internal factors. Enamel wearing out, more exposure of the dentin, causing our teeth to become more darker. Okay, dry mouth. I was suffering from dry mouth just now. Okay, that's stage fright. Other than that, okay, we also have dry mouth caused by reduced saliva flow. Okay, we have our saliva in the mouth, which is secreted by the salivary glands in the mouth, and those glands, when they are damaged, then the salivary flow reduces. That's why when we feel our mouth is very dry. Okay, it can also be due to post-cancer treatment. Okay, we have radiation therapy, chemotherapy can also cause the dry mouth. Not only that, okay, some diseases like Sjögren's syndrome, okay, is one condition where you can see the active dry mouth condition. Okay, psychological conditions, okay, when you have a lot of stress, like I told you just now, can also lead to dry mouth. And more importantly, okay, the last one, medication side effects. Okay, you heard about medicines just now. Okay, we need medicines in our life. I'm sure if I take a count here, surely there will be not less than 4-5 medicines which many of us are taking. Okay, so we cannot run away from that, but we should know that that can have a side effect causing the dry mouth, and probably we should know how to manage that. Okay, so that is about dry mouth. Then we have a diminished sense of taste. Okay, this can also be due to advanced age, compounded by diseases, medications, and also denture use. Okay, when you have a denture in your mouth, the artificial teeth. Okay, I'll go for the first question here. You're aware that we have 2 sets of teeth, right? You have your primary set, you have your secondary, or your milk teeth, and then you have your natural, what we all have now. The milk teeth, they start coming out when we are 6 months old. Okay, so they have been there for a long time, 6 months already there. And then they start shedding, they fall off, and it's replaced by permanent teeth. Okay, permanent teeth starts around 6 years. You can see this. Okay, many of you will be having your grandchildren with you. You can see them crying a lot. Okay, and the 6 months time, and then you can see that suddenly they have the teeth jutting out, big teeth jutting out. Okay, around 6-7 years that happens. Any supposed to have all the teeth missing? Any expiry date for the teeth? Can I get an answer from somebody? First prize? You have to lift your hand, otherwise. Okay, yes, madam, you lifted your hand. No expiry. Yes, that's what we have to remember. We do not have an expiry date for our teeth. They are supposed to live with us as long as we live. Okay, but we tend to neglect it, thinking that it's tidapa. Okay, I'm again using the same word. Okay, so very important for us to realize that the secondary set of teeth that we have to be retained as much as possible. Root decay. Okay, as we age, the gums start receding, and once the gum starts receding, tooth is known as the inner part, which is on the crown surface of our teeth. So that is why you tend to hear that the person or your dentist telling you that you have root caries. Okay, so as we age, the root caries becomes more a problem than the caries on the surface of the tooth. Okay, so that is because the exposure of the cementum, and the cementum is more vulnerable to caries activity because of its nature and the structure. Gum disease, okay, it's caused by plaque. Okay, you would have all heard about plaque, calculus. When you go to the dentist, first thing they do is tell you need a cleaning. So they do the cleaning to remove this calculus, that is hard deposit. Okay, plaque removed. When you brush your teeth, you can remove the plaque. But calculus becomes hard deposit, the special instrument to remove it. Okay, so the longer it is deposited there in the mouth, the disease of the gums takes place, and that leads to the tooth loss at the end. Okay, tooth loss, normally it is by the gum problem. It can also be because of deep cavity and too much of tooth destruction that you cannot save your tooth. So those are the two reasons why we normally remove the tooth. Uneven jawbone, okay, if you see this here, you see that, okay, it's like Gunung and Bukit. In the mouth itself, we can see that they are different elevations at different parts of the jaw bone. And why is this? Because we do not remove all the teeth at the same time, right? We remove, probably one tooth was removed when we were 12 years old. Okay, we had to be removed. Then subsequently, more and more teeth are being removed at different intervals of time. Okay, so the unevenness of the jaw will be because they were extracted at different times. And sometimes when the tooth is removed, more of the bone is lost, okay, because of a traumatic extraction. So you lose more bone in that area. Okay, thrush is what you normally see on the tongue. Okay, and this is caused by diseases or drugs that affect the immune system. Okay, and can trigger the growth of this fungus called the Candida albicans. Okay, so these are all the, okay, one other thing is the denture-induced stomatitis. Okay, again, inflammation of the gums, of the palate because of the, what you call the ill-fitting denture, one, ill-fitting denture, and two, poor denture hygiene. Okay, this is why I'm happy that I see that both our seniors as well as carers and caregivers are here, because in oral health probably there will come a time when somebody else have to take over the care provision. Okay, and that is when the caregivers should know as to what they have to do, what is their role in providing the care. So denture stomatitis, again, because of ill-fitting denture, loose dentures in the mouth, we think, oh, I can still chew the food. No, it can cause other damages, and one of them is this denture-induced stomatitis. So if someone under your care needs help eating, that means they will probably also need help with their oral hygiene. Okay, it does not just be feeding a person, but also we have to make sure that the oral cavity, the portal of entry into the mouth, is properly maintained. Okay, so practice effective at-home oral care methods for your loved ones who are unable to perform personal preventive practices themselves. So now we will go into some of the methods that we need to remember to keep our oral cavity clean. Okay, the first one is for us to do on ourselves. Okay, oral hygiene tips. I'm sure you've heard all this, and I'm just re-emphasizing why it is important. Brush twice a day. Use electronic or sonic brush. Okay, I'm not a promoter of this, don't worry, I'm not promoting. But the idea is it helps you do the cleaning for you. Okay, you just hold it in place and you can brush, get a good tooth surface cleaned because of the motion that is taking place by the toothbrushing. Okay, and also if a carer is providing the care, it becomes easier for them to provide the service also. Okay, so that's why it is recommended, and now more and more people are also using it. Okay, it's when I first saw this, it was like so big. Okay, and it can be put in the pocket wherever you're going. You can just take it out, remove the sleeve, and brush your teeth and keep it back. Okay, so it's become very portable also. Clean between your teeth. Flossing, okay, is very important. Flossing, okay, is very important. It's not just the outer surface of the tooth, the surface between the teeth are also need to be cleaned. Okay, rinse with an antiseptic mouthwash. If wearing full or partial denture, remember to clean daily. Okay, it is not something that we just leave it like that. We have to daily take it out, clean it, put it back, and also allow some time for our oral cavity to rest. Okay, so a little bit of time when you're not engaging yourself in speaking or smiling, smiling, you can also keep it away from your mouth so that you give rest to your gums. Okay, drink a lot of water, and we have we are lucky that we have many of our places have fluoridated water. Quit smoking. I need not emphasize on this. Visit dentists regularly. Okay. Again, another important thing, because if you look at statistics, it is when we are parents, we make sure that our children go visit our dentist. When we become adults, we see, okay, if the need is there, we go. But when we retire, then we think it is not necessary anymore. No, it is important, okay, to visit a dentist to make sure that there is no serious consequences to our general health. And eat healthy, well-balanced, okay, already explained to you earlier. Now, caregiving for an elderly, you may have a parent or spouse or a friend who has difficulty maintaining a healthy mouth on their own. So how can you help? Okay, many of you are here sitting here. So you will also be able to help provide the care for your family members. Help them to keep their mouth clean with reminders to brush and floss daily, and make sure they get to the dentist regularly. This is one thing that you can keep emphasizing when you see them or when you talk to them. Make sure that they are comfortable in their oral, because many a times we tend to, even if we have pain, we have the tolerance to pain, I suppose, more. So we tend to neglect even the pain in the oral cavity. And these steps can prevent many problems, but tasks that once seem to be simple can become very challenging. Okay, that is what those who are carers or caregivers need to understand. Okay, because you may feel that, I have 2 minutes activity only, putting the brush in the mouth, cleaning and taking it out, but it has got its own challenges. Now, if your loved ones can brush and floss on their own, then find out their daily mouth care routine. When are they doing their brushing, so that you can have a look as to if they're doing it in the proper way or not. Talk about the importance of the healthy mouth. An unhealthy mouth can make other health problems worse. Okay, it is proven beyond doubt now. Okay, the oral health is very much part of the general health. If you have good oral health, you can be rest assured that there is not going to be a source of infection from the oral cavity that will affect your other systems in the body. Help them set up and maintain a schedule for brushing twice and flossing once a day at least, okay, and using an easy to handle. Now again, as we grow older, our grip may change. So again, making sure that the grip that we have on the toothbrush is important. Okay, so either we ourselves note this, or the family members or carers can have a look at that, and if need, make some adjustments to the handle of the toothbrush, because it's not just putting the brush in the mouth, it has to be effectively used to have a good oral hygiene. Make sure that they're using fluoridated toothpaste. Most of our toothpaste are fluoridated, but it will be good if you can have a look at the box. It will be written there, fluoridated toothpaste. Okay, it prevents or it reduces the chances of cavity forming. Use fluoride or anti-plaque mouth rinses daily. May also provide additional protection from bacteria for the teeth as well as for the gums, and get them a 2-minute timer. Okay, this is something that it's always, if you go to your dentist says 2 minutes, brush your teeth. Okay, so make sure that, okay, my time is almost there. So that's 2 minutes. She just told me 2 minutes. I'm also telling you 2 minutes. Okay, so you can use the timer to adjust your time so that you know how you're using it in the proper way. And offer to make dental appointments. Okay, if they are not able to go to a dentist, offer to help them seek the appointment as well as take them to the dentist. If your loved one needs assistance, then before you begin, prepare the work area. Make sure the lighting is good and have a flashlight. Okay, it is not, don't sit in the in a lying posture and try to help them brush their teeth. Okay, it is important that the seating as well as the lighting is adequate for you to be able to provide the hygiene care for your loved ones. Have the person sit up in a straight back chair and drape something like what you're sitting now, okay, in that position. Drape a towel over their chest to protect their clothing, have the person seated in front of a mirror with you working from behind or on the side of that individual. Okay, it will be better if you can see the demonstration. It will be more effective. Probably we can arrange something for the carers later, another day. Okay, as to how to provide the oral hygiene for your those who are caring for. Okay, hold their chin gently with one hand and show them the brush. Okay, it's very important, especially those who are not able to communicate well with us. Don't just suddenly put it into their mouth. Okay, explain to them what you're going to do and how and what you're going to use, and then start the process. Okay, floss or toothpaste before you start using it. Okay, explain what you're going to do and make it enjoyable for them. Okay, another key word, make it enjoyable, and every day when they say you, they can relate you to a clean, fresh mouth. Okay, that will be the best way to approach it. Play music, tell jokes, or get inventive to make the time caring for their mouth fly by. Okay, otherwise it will be a trauma for the person you're providing the care for as well as for you. Okay, so make it as pleasing as possible. Now, if your loved one continues to resist brushing, it may be because they are experiencing pain or have a dental need. Okay, try to communicate with them. If not, try to get an appointment with the dentist. If your loved one has a denture, okay, dentures, whether partial or full, need to come out before bedtime. Okay, I mentioned this earlier. It has to be kept out of the mouth so that we also give some rest for our oral cavity. Scrub them carefully at night and store in a cup of water. Rinse the denture before putting them back in every morning. Okay, you can use denture cleansers. Don't use it daily. Try to read what the manufacturer says. Okay, it's usually once in three days or once in twice a week. So just only on those days you use the denture cleansers. Otherwise, just use a brush and tap water to clean. You do not need to use toothpaste to clean your denture. Dentures may dislodge and may cause choking. And make sure the denture is labeled. Okay, especially if you're in a nursing home. Okay, it is very important to make sure that the denture is labeled. Otherwise, what will happen is I am here, there's somebody else next to me, and probably the denture will be visiting different individuals. Okay, you may not be able to identify whose denture is which. Okay, so get your dentist to label it before you get it from the dentist. If your loved one's in the hospital or confined to bed, when you're caring for someone who is confined to bed, they may have so many health problems that it's easy to forget about oral health. Okay, this is again emphasizing for the carers in the hospital as well as nursing home. However, it's still very important because bacteria from the mouth can be inhaled into the lungs and cause pneumonia. Okay, we have not done much study in this area, but there are a lot of study, okay, in scientific literature saying that a bad oral cavity, poor oral hygiene can be a source for pneumonia. And the last one, if your loved one has a memory disorder, okay, 1 in 4 caregivers caring for someone 50 or older is doing so because the person has Alzheimer's, dementia, or any other memory disorders. So people with dementia also need to get their teeth brushed every day, twice a day. Okay, no exemption for that. Good dental hygiene is even more important because they often cannot communicate when there is a problem. Okay, that's the other big challenge because you have to be able to identify that issue and make sure that you tackle it. If possible, take care of any potential dental needs in the early stages of the disease. Okay, again, it's good for physicians also to be aware of it. Okay, because as you see your patient progressing in this memory disorder, the tendency for them to forget about the oral cavity or for the family to forget about the oral cavity, oral hygiene becomes more. Okay, if possible, take care of any potential dental needs in the early stages when the person can cooperate with the dental care and discuss their needs with the dentist, or even take X-rays, okay, some baseline radiographs that will help in the future. Establish a relationship with a dentist who knows your loved ones. Okay, it's good to have a good rapport with a dentist, a neighborhood dentist, or somebody who is the child of a friend. Okay, somebody you can relate easily. Have a good rapport with them so that they can give you advice just by a phone call. Probably they can tell you, oh, okay, try this or try that before you take them over to see the dentist, to the dental clinic. Okay, so yeah. Okay, this is again more towards nursing home care. I don't think, are there anyone from care homes here? Okay, so again there are different methods of managing. Okay, this is what I wanted to emphasize. It's not just we taking care of our teeth. Okay, sometimes it becomes our loved ones will take over. Sometimes it will be a carer who will take over. Sometimes when we are admitted in the hospital, the nursing staff will take over the care of our oral cavity. Okay, it is not just teeth, the whole of the oral cavity. I'm finishing now. Does anybody here have full set? Okay, I can't ask you all about this. Anybody here among our seniors having a full set of teeth? Anybody with full denture? Okay, so I'll give you one this. Okay, what will be the next question? Okay, I'm done. Okay, I'll have anybody else want to try this?
Okay, my dentist advised me use water tender frosted colors for teeth. Sorry. My dentist advised me to use water tender frosted colors for teeth. So actually I bought one before. If I one before, I used it for half year, the water pick. Then it can't be used already. So now may I know, actually is it better for us to use this or we still can use the tender frost?
You are now trying to create enmity between me and your dentist. Okay, what is important is you do the flossing. How you do the flossing depends on your ability. So if you can use the floss by itself and put it in your mouth clean, go ahead. Then you have the next stage where you have flosses which are disposable, which comes in that stick form. Okay, so each one you use can throw away. Okay, again it becomes easier, you don't have to put your hand inside the mouth and all that. It goes just like that and cleans. Okay, if you want more change, yes, you can use the water pick. It's not only flossing, it also hits water in a heavy motion, so it helps dislodging the food from the mouth. Okay, so I'm not going to say it is not appropriate for you to use that. When we come, okay, when we come to technology, we also have to make sure that technology is helping us. Okay, once that instrument is not working, then you probably will have to get it replaced or get it. Normally, we will not be able to get it repaired. Okay, so that's the issue. So I'm not saying that it is not right for you to use that, but if you're able to floss in any other method, any other manual method, go ahead and use it. Okay? Yes, sir.
I wish to make a comment here. I am using both the dental floss and the water pick. I use the dental floss first. Then after that, I use the water pick. Now, after using the dental floss and then the water pick, I can still find the water pick dislodges quite a crucial amount of food particles in the water that I collect. So I find it's very effective. So I'm using both.
You know the answer, what I'm going to say now. Okay, sir, so from today, you are going to use three materials. You are going to use your floss, you are going to use your water pick, and you are going to use the sonic brush. It's going to be very effective. Okay, I'll introduce another. You have interdental brushes. Interdental brushes. Okay, when you have space between your teeth, the floss is not going to help. Okay, so you will need the interdental brush. They come in different sizes. So depending on how much of gap you have between the two teeth, you can get those interdental brushes to clean that area. So maybe next time I see you, you will have 4. Okay, so there are a lot of things in the market. You have to see what your needs are. Talk to your dentist. They will give you the ideas. And it's up to you. What suits you best? That's most important. For that, you have to visit your dentist. Yes. Thank you. I'll be here during the break. Any questions I'll take up. Thank you.
Thank you, Prof. Jacob, for the insightful talk. There will be a special oral care session at our caregiver training next Wednesday, 19th of October. So for more details, please approach the information desk outside the hall or any of the organizing committee. So the Center for Disease Control and Prevention recommends at least 150 minutes of brisk walking per week from those aged 65 or older. To help us achieve this and more, we would like to invite UMMC's physiotherapist from the Rehabilitation Department, Mr. Lokman Majid, to give his talk on improving physical activity through exercise.
Not detected. No.
I have your original slides lah.
Alamak. So how?
Ini bukan lah.
No, not the one. Try again. How about this one?
Ini ada tebal. So saya tak buat. Kita boleh cuba. Tak buat.
Tarik keluar tu. Masukkan dulu dan download dia lah.
So which one?
Plug up first.
I don't know what is this. I really don't dare to pull this up. Especially if you lose the connection, it's even worse. Okay. Next time you send this to me lah. So itu rasa nikah.
Tak detect.
To avoid all these things.
Tak ada. Tak detect. Macam mana? Macam habis kita.
Slide lama lah. Slide yang ada tu tadi.
Tak ada. Tu.
Kat belakang slide.
Tak detect.
Benda tak detect ni. Tengok aku tadi. Kong kan ni. Benda kalau kong payah kan. I think Lokman they might just have to show slides.
I sent to you, right?
Yeah, the one I sent.
So where? Any backup? Cuba jap. Tu. Yeah. Okay.
Ini mouse.
Dah clear dah. Okay.
Alright, Assalamualaikum. Good morning. Thank you for everyone to coming here, attending our International Day of Older Person today. My name is Lokman. I'm working physiotherapy for in elderly since 2009 till now. So mostly some faces I may recognize here. Madam Latifah, selamat pagi. Assalamualaikum. I know her since so long already. So basically, I'm attending elderly people. Those are coming to me. Those are weak and had a fall many times, medical background. So they basically need my advices. So today, as well as as 2020. So patient coming to me. Those are post-COVID infection. They stay at home. They don't know how to do exercises. Mostly they asking a lot of questions. What should I do, Mr. Oman? I cannot come to hospital. Quite hard, PKP and those things. So basically, they coming to me and seeking and some advices what they need exercises at home. Alright. So so we're going to see this Mr. Ariel Kasami. There is this guy. He's elderly, which is 70 years old. Yeah, still going strong.
I started my bodybuilding on age of 18 because one of my friends recommended this event to me because I play all round games. My parents stopped me playing because of fight and this. So I started bodybuilding until now. So now I know that my body cannot. So like bench press last time I do about 280 pounds, 250 pounds. Now I do about 90 pounds a day. Because I'm not taking any vitamin tablets or this.
So he's one good example of a Malaysian, and he's own a lot of trophies. Go Southeast Asian Game. It's one icon here, and he's still doing the exercises and his own gym, and he has small gym with a bed.
So wife, you're coming to house the second wife. You get a shock, no? My wife is the first one in my grade.
So one example here, our Malaysian. So whoever is 50 years old, raise your hand here, please. I want to know. I want to hit count here. Anybody 50 years old above? Do you feel that you're able to build your muscle in 50s? Whoever say that cannot, you can. Right? There's a way and many way. Too much nasi lemak. Okay, now see this guy, Mr. Ong Kim Hua, 88 years old. Shock, He ran half marathon in PJ. See how many medals he had. Now I spoke to him through the Facebook and talked to him. He said, okay, you allowing to take my pictures. So I granted from him. So he won this what's called Penang Bridge Run 1989. Then he collects all this, pursue all the trophies he made. So he's doing basically daily exercises, which is run and run and run, keeping running. Even though he said to me, I have hypertension. Doctor say my bone is porous already. He don't care. He still run. So I salute him. All right. Okay. See another guy here. See 90 years old. Went to Kinabalu. Lately quite viral. He's not using any sticks and he's climbing up to the Kinabalu mountain in Sabah. Okay, what happened here? Okay, now you know him, right? Yeah, so all those leader.
I lived a very moderate life. I don't do anything in excess. I don't eat food until I get fat and that kind of thing I don't do. Well, I look after my health generally. To keep the mind active, you need to read, you need to think, you need to argue. If you don't use your muscle, the brain is also like that. If you stop thinking, you just dream along and don't study, don't read, then the brain will lose its capacity to think and to function. Chronological age is 93, biological age is not 93. Sometimes people are younger than their age.
All right. So we're going to see on the slide. So in this what I have read and I referred. So in our standard universals recommendation for all age group, which is exercises for preschool, they do throughout the day, active play, children, adolescents 6 to 17, a variety of physical activities, vigorous running, soccer, gymnastics. Adults encourage 150 minutes a week brisk walk, 2 days a week, strengthen the muscle. For older adults 65 and above, at least they do a brisk walk around 150 minutes to 2 days a week, and to improve balance, able to stand on one foot. So this is encouragement to do continuously for elderly people. So in our physiology for aging, which is involvement of nervous, respiratory, skeletal muscle, digestive, urinary, all over the coming towards our body system when we age. So a lot of reduction there, basically, right? So what is meaning of physical activity and exercises? So physical activity, which is you consist of body movement, consume energy. Exercises, which is like relates to ability to perform physical activity. Okay. Alright, so what happens here, we have frailty. So you can see that's into physical reserve, brain, endocrine, immune system, respiratory, renal, so all affected. So stressor maybe have some falls, delirium, and increased care need admission to hospital long term. This is reference to the paper of Clegg et al. So when less inactivity, we having a called sarcopenia. Skeletal muscle, old people, they had reduced in muscle mass, which is sarcopenia, decreased muscle strength, power, and endurance. So they're getting easily tired. Inactivity, stay at home, relax, nothing, so getting more fats. So this, which is CT scan, showed that we can see the circumference of muscle. This is a male, 24 years old, body mass 76 kilo. So all the muscle quite big mass. Okay. Then D and E. D and E, some of the D which is inactive. So you can see that he do 3,141 steps, and so the muscle mass is not so great. Rather than E, Mr. E, 66 years old, he do a daily step 12,445 for 130 minutes. Which you can see comparing here, which is inactive person and active person. So the muscle mass is some difference there. Okay, so when you're getting old, okay, we are reduced in muscle strength. So it's all environmental factors involvement here. So why does sarcopenia occurs? Okay, it's irreversible. That due to inactivity, nutrition, less protein. So maintain how we establish a program. So mostly doctors are referring to physio to maintain or increasing strength of the elderly people. So when having sarcopenia, you have lack of nutrition, you will have definite loss of muscle strength, you easily reduce work because of inactivity. Okay, by through what? By through a resistant exercise to build up the strength, and some aerobic exercises. Okay, so the best word is now you need to use it or lose it. Alright, so this is common barriers, exercises in older adult. So self-efficacy, so you need to provide frequent encouragement. Keep on exercises. Auntie, uncle, popo, nenek, atuk, buat je exercise ni 1 hari 5 kali. Saya kadang-kadang diorang jumpa, malas lah Encik Lokman, saya tak mau lah, boleh buat lah, tak lah, sama saja, tak ada kuat, dah naik tangga sudah penat. So that need to encouragement. Attitude, we give support, family support very good. So they need a lot of background support. Discomfort, so tempat yang they exercise, which is like the place that they doing it not so very friendly, so ask them to get some community establishment. Okay. Disability, employ personal trainer. So when they have some stroke and poor ataxic balance, may use this assistive device. So prescribing, ask them to use a stick or walking frame properly to use when they want to exercise. Fear of injury, so appropriate attirement, shoes, long pants. Fear of habit like he's like to eat while exercises. It's okay as long as person that willingness exercise is there. Okay. Fixed income, cannot go to fitness gym, expensive. So ask them to do free exercises community. They can go for Tai Chi, yoga, and encouragement to do them. Environmental factors, so as what I said just now, cognitive decline. So the most important is they need have some diary or exercise to keep on daily routine. Okay. Fatigue, so use range, variety of modification energy level based on their level. Okay. So risk for adult. Okay. When we do for prescribing exercise, we need to do some PAQ. Okay. PAQ, like physical activity, question and answer. So adult may start with light to moderate exercise. They are not increase of musculoskeletal injuries. Okay. May begin slowly and gentle stretch. So preparation of hazard at home needed for exercise equipment. So example like PAQ here. So doctor mostly asking to patient. Okay, there's some general health question, yes and answer. So they will asking a lot of have you checked recently your heart condition, your blood pressure, what is your suitable blood pressure, are you taking your medicine well, keep on track. Okay, this is the question, yes and no. Arthritis, do you have any cancer of kind? So this question need to be pre-test need to be done when we prescribing exercise for adult. So yes, a question answer or yes no. Alright. And if patient is fit for exercise, they will need to go through with the declaration above. So best recommendation for exercise medical condition. Okay, I have met a lot of patient which is underlying more than 3 or 4 condition, which they have osteoarthritis, cardiovascular, diabetic. So based on what on the square down there is a rate perceived exertion. Okay, progressive resistive exercise untuk condition people that having OA, cardiovascular, diabetic, they need to do 2 to 3 times weekly at 13 to 17 box sales. So you can see on here, so they have slight breathlessness and can talk. So when prescribing exercise for old people, they need to communicate with you. So while doing exercises, you need to talk to them. If they cannot achieve the talking to you, which is the rate is higher. Okay, aerobic exercise like walking, biking, aquatic exercise. Okay, depend on the box scale. This is a box scale on the right side. So people that have respiratory disease, we need to separate the exercises. Okay, we need to train the upper body like arm ergometry, separating it, lower body static cycle. So depends on the most important, they need to know to self-monitor dyspnea. So patient had respiratory disease, they need to tell you, I am having panting. So if they unable to communicate that, so you cannot recommend any exercises for them. So patient for the stroke, okay, we need to do progressive resistive exercise, 2 to 3 weeks time, 8 to 10 repetition. The aerobic, we are recommended for slow, moderate pace treadmill, okay, for the stroke in elderly, to progress to 30-40 minutes a day. Okay. Then we included task-specific training like rising from the chair, ascending staircase, squatting. So stroke in elderly, they hardly to do this, okay, because incapability to perform any multitask. So people elderly have osteoporosis. We focus on the muscle strengthening, low back areas. Okay, people osteoporotic in elderly, they will have vertebral osteoporosis, which like having pain in the spine. Then hardly they weakening of the extensor muscles. Okay, aerobic training like strenuous fast walk, stationary step exercise. So condition like patient with having falls, poor balance and mobility issues, encouragement for 2 to 3 sets, 8 reps, aerobic training, brisk walk. Then depends on the box scale, like what I say, that 11 to 12, 13. That is their limitation. So additive is like encouragement for dynamic exercises, Tai Chi, high voltage concentric exercise, seated exercises, functional stop and over. So example, patient had this diabetic mellitus type 1, type 2. So adjustment strategy, they need to take insulin 1 hour before exercise for that type 1. Type 2 very rare for hypoglycemia, so they need to reduce dose. Okay, people having strategy for making meals at least 1 to 3 before exercise, and they need to do self own parameter, glucometer. If taking insulin for type 2, main supplement feeding, say like small chocolates in the pockets when we do exercises before that. Strategy for self-monitoring blood glucose before, during exercise and after, because want to know any changes of insulin dosage. For type 2 is no need to checking for self-monitoring. Determination of a unique metabolic response, so learn effect exercise at different times of day. Okay, for type 1 and type 2, this is comparison. So basically, elderly people, they were asking me, should I go for the gym, Mr. Lokman? No need. You get some easy, cheap one, sandbags, dumbbell less than 3 kilos, a stick. Okay, then home self, omron to check, and pulse oximeter. And the most important is either caregiver or the children or the patient itself has own personal diary. So it's like you keeping track themselves to do exercises. So when they coming to me to seeing for the therapy session, most likely I will some assessment on strength, balance and their walking ability, and depends on their scores. So this is 30-second chair stance test. We determine the leg strength of the legs. Okay, patients sit on the chair with the armrest, and they need to sit and stand up without holding the hands lah. Example like here. Okay, sorry, the picture is up and down. So asking with 2 hands first whether he pass, then to again. So this is for lower strength extremities, legs, where they need to perform first to determine what their level is. Okay, to 1 hand hold. He is able to do it, and now commencing for the test, and he able to do it. It is 30 seconds. How many times that he can do? So he's quite elderly patient to me. He's 89 years old and he's not using any walking sticks, and he always say that I can do it, I can do it. So I just provoke him. You can do it, Mr. Chong. Okay. So this is norm values for those 60 and 65 above. Average for men's, basically they able to do 10 to 15 for age like 80 to 84. is quite okay. Less than that, they need progressive resistive exercise. It's for the strength, okay? So balance. Okay, why does need balance? Very simple, easy to conduct. Okay, you need to put the legs together, feet together, stand straight. Then need to put another step forward, and in tandem, and one leg stand. So these tests, elderly people, they need to do it. They know how good they are. You can do the test on yourself, for your own parents or any family. So the TUG. So when come for this, we need to know how speed they are walking. So it's about the 3 meter on the floor. Then they go in one place and come back as much as he can, own pace. Then whoever that completed the test more than less than 12 seconds is quite normal for them. Okay, it's 3 meter walking, and you time them. So here, whoever have a phone, QR code may have scanned here. I have some module which is you can reference to. Okay, alright. Can anyone done already? Okay. Kalau sudah buat, boleh tengoklah. So itu adalah one of part of my what I have learned. So when we are dealing with old people, they will asking a lot of question and this and that. How many times I need to do these exercises? So when we have gadgets, we prescribing exercises, variety of them, too many, so they cannot remember it. So best way is by this exercise through the website. Either you can download it and printable. You print it out, then example Monday, Tuesday, Wednesday. Okay, now you need to raise your leg 5 times a day. So need tell that you want to improve your walk. So he do day by day 5 times, so equal amount. So in that website, you can printable it and give to the people that needs for close monitoring exercises. So like this, my one of my good patient, and that is the son. Then he's looking after the exercises. I have start not tight. So you can see that he's looking at the instruction, the one that I printable. Then his son is monitoring her and do the exercises 5 times a day. So okay, so in that module you can see that there's some flexibility exercise with the picture, turning head to check, side to side, back stretch, turning your trunk side to side, lifting your leg and swivel your ankle. Okay, so resistive exercise, like what I say, you put a sandbag at your ankle, you lifting up, sit on the chair, you do 5 times a day, you stand in front of the chair, lifting it up. Okay, this is resistive. Okay, example like this for hamstring, for the hip. Okay, raising the legs up and down alternately and squat down. Okay, for balance, you can do either walking forward, holding cabinet, lifting the leg up, then vice versa, sit and stand up. Okay, not holding anything. See, from the side, then no hands, but progress to 2 hands. Okay, walk backwards. Okay, then tandem walk, and you put a chair in the home. Put chair in figure of 8, walking without any aids. So this is the video. We haven't started yet. Sorry. Okay, so example, this is my patient. It comes to me. They have own self check. Okay, you either they had done the exercises, how to progress it, then you can monitor it day by day, and they coming to see me 2 weeks time. They say we test again how good your perform is, whether the exercises is safe for you. So they tell me I have no fall, I am better now, I can walk more faster. So by through this exercises daily. So advisable for adult, walking just 1 hour a week may ward off disability. So goal setting, you need to specific what exercises you want to do, measurable it, attainable, need to be relevant and time bound. A good social support, environmental cues. So some tracker, you need to do diary, you know. Once if you had a fall within 1 month, then you need to complete it. Okay, things to remember, need to wear cool, light fitted clothing, drink more water, appropriate shirt, and listen to your body and not push yourself. So this is my references. And any question from anyone? May have some anything, you can call me 79498153. Okay. Shall we do some tests on anyone spectators here? Who the oldest patient here? Can raise your hand, please? I can. Are we in hurry? No, let's go. Okay. Some test. Anyone can do some test with me for balance test. I really volunteer. Kan? Auntie in blue shirt. Auntie in blue shirt can stand here. Yes, you. How old are you? 77. Wow. Right, round of applause.
At least 3 times a week. At least 3 times a week. Yes, at least 3 times a week.
So how are you keeping the day by day by doing and checking your own self diary or anything?
No. I walk a lot and I run up and down the stair. I do a lot of gardening.
Enjoying it?
Yes. Yes, very much.
So now, can you and me,
yes,
checking some balance.
Yes.
Can you do on your waist? Then you squat down 5 times a time?
5 times.
Can you do that?
Yes.
Yes.
Apa maksud dia kalau kita tak boleh balance?
So, I got physio for one of my older relatives recently lah, and like you, he gave me a list of equipment to buy. Very expensive. Really, dumbbells, all the TheraBand semua tu not cheap lah. Then Omicron, sets semua tu, it was quite expensive. So, is there anything that some of our patients can use, like that could be cheaper, that have to buy one, or can we use like maybe like the baked bean punya can lah instead of dumbbell, because the baked bean sometimes you get the besar punya can be about what 750 grams kan, can or not lah, or must buy all the equipment lah.
The most cheaper and easy to get, what I say, you can marble, put inside the bottle 1 liter, you lifting the marbles, or you put sand inside together with the marble, so a bit weightage there, at least achievement is 1.5 kilo. So other people, they need more than 1.5 kilo achievable. Repetition is starting with 5, 10, 15. So you can modifiable equipment at home rather than buying a new things and expensive. Any more question? Right. Thank you very much.
All right. Thank you very much, Encik Lokman, for the very insightful talk. So it's 11 o'clock now. We will have a short break for everybody to stretch and exercise and probably test out your balance. We will come back at 11:10. So I would really appreciate it if everybody can just settle down before then. There are a couple of tokens for those who have not collected outside. And we also have some exhibitions and booths at the ground floor of Plaza PPUM. So maybe after this you can check them out. So we will have our break now. Thank you very much, everybody.
So tujuan saringan tu apa? Tahu tak? Sometimes banyak my relative kata, oh tak nak lah nak buat saringan tu, takut lah. Tak check tu tak ada apa. Tapi kalau check tu mesti semua ada. Betul tak? So semua orang takut. So betul ke macam tu? No right, yeah. So kami kena bagi tahu lah kawan-kawan, ahli keluarga katakan kalau tak buat saringan, mesti kamu tak tahu ada penyakit apa-apa yang the hidden lah, yang tersembunyi. Tapi kalau lepas buat saringan awal, penyakit tu dapat detect awal, dikesankan awal, lepas tu rawatan boleh mulakan dengan awal lah. So that's why untuk reduce mortality, maksudnya kalau detect awal, kita boleh mencegah dengan cepat dan rawatan boleh startkan dengan cepat. Yang ni pun sama juga. Kalau kami treatkan benda yang start yang macam, let's say kalau katakan kanser pangkar rahim, kalau dah buat saringan, kamu detect awal, boleh buat rawatan dengan awal supaya dia takkan jadi pangkar rahim kanser yang betul. Lepas tu, also to reduce the severity. Maksudnya, severity, how to say? Okay, maksudnya keterukan penyakit tertentu. Okay, sorry my Malay not sure whether good or not. Okay, so to see kalau katakan kalau detect awal, let's say breast cancer, dah buat operation, then you can detect early and start treatment early. And of course to increase your choice by identifying the condition or risk factor. So kalau katakan detect awal pun banyak cara dan banyak jenis rawatan boleh dibagikan dan di-share lah. Let's say kalau detect breast cancer awal, sama ada nak buangkan kanser kecil tu sahaja atau nak buangkan semua ke, atau nak buat radioterapi ke, kemoterapi, banyak pilihan. Tapi kalau detect lambat macam mana? Dah bernanah, berdarah dan teruk dah, yang tu nak buat apa-apa pilihan lain pun dah tak ada dah. That's why biasanya kami katakan saringan tu penting lah untuk buat dengan awal. So biasanya saringan kita kata terfikir cancer screening kan. Okay, tapi jangan risau. Yang kami katakan detect awal, boleh rawatan startkan awal. So boleh tengok dari sini, biasanya cancer tu kami katakan incidence cancer biasanya naik lah dan biasanya paling tinggi dalam umur yang lebih lanjut lah. Usually above 60 years old and 60 years old and above, kami nampak banyak lah cancer akan berlaku. The commonest among female adalah breast cancer, payudara. So kami sarankan untuk buat saringan untuk patient atau sesiapa pun lah, walaupun bukan pesakit pun, sesiapa umur 50 tahun ke umur 69 tahun lah. So semua kat sini dah pernah buat mammogram tak? Bagus. Okay, so usually you can do 2 yearly lah untuk mammogram. Okay, lepas tu untuk pangkar rahim pula, yang ni kalau katakan awal kami boleh start 20 ke 65 tahun. So for yang saya bolkan kat sini ni 50 ke 65 kami boleh buat pap smear. Kalau katakan in between boleh buat kedua-dua lah, HPV maksudnya satu test DNA virus atau pap smear, dua-dua sekali pun boleh. So since that this is a international elderly talk, so what about patient above 65 years old? Boleh buat tak pangkar rahim punya saringan? Boleh. Okay, so kalau katakan, yang ni banyak sikit lah perkataan, I just summarize. Kalau katakan dah pernah buat dulu, 5 tahun yang lepas dah pernah buat, 2 kali dah pernah buat HPV testing. Kalau katakan negatif, dah cukup, tak payah buat dah. 65 tahun ke atas pun tak payah buat. Tapi kalau katakan for pap smear, kena buat 3 kali lah, 3 kali for the past 3 years. Kalau negatif pun tak perlu buat lagi. Tapi kalau tak pernah buat langsung, never done pap smear before in your whole lifetime, boleh buat tak? Boleh. So patient datang, takkanlah panggil patient balik kan? So you still have to do for the patient lah. Takkan kesian, you balik lah, kami tak buat. So you can still do for the patient up to 80 years old for pap smear screening. So kalau kanser pun biasa, usus besar, kanser usus besar, biasanya kami sarankan untuk patient 50 ke 75 tahun ke atas untuk buat 2 tahun sekali. Untuk cek, macam mana kita cek? Cek najis lah. Okay, so kalau yang ni yang risiko biasa lah, boleh cek najis. Kalau risiko tinggi, macam ahli keluarga ada kanser, boleh terus buat kolonoskopi lah, skop terus. So siapa yang kerja kat PPOM, mana botol, which botol yang kena ambil untuk cek yang najis? Yes, very good. Ya, yang ni pun dah tulis lah, feces container. So we can actually advise our patient atau katakan patient audience kat sini, kalau katakan nak buat saringan ini, boleh minta dengan doktor je. Katakan, oh doktor, I nak botol yang warna coklat tu untuk test. Okay, untuk test untuk colorectal cancer. Prostate cancer agak kompleks sikit lah untuk lelaki. So yang ni perlukan macam kami katakan counselling yang selanjutnya sebelum nak buat saringan prostate cancer lah. Because darah untuk ambil untuk test prostate cancer ni dia tak ada spesifik sangat untuk cancer. Dia boleh disebabkan penyakit lain-lain jugalah. Okay. Tapi kalau katakan nak buat tu boleh bincang dengan doktor lah. Alright, yang tu for men lah. So lung cancer pun kita orang boleh buat screening, but mainly for those yang merokok dah 20 tahun ke atas dan masih aktif merokok, ni kami boleh buat screening lah setiap tahun untuk patient 50 ke 80 ke atas. And usually kami buat CT scan. Boleh guna chest x-ray tak untuk buat? Rasanya boleh tak? X-ray biasa. Jawapan tu ke atas lah So biasanya kami guna low dose CT scan lah, kami tak guna x-ray, okay? So ni cardiovascular screening. Okay, biasanya kami kata saringan tu cancer je kan. But actually we do have other screening lah, saringan lain juga. Yang ni cardiovascular maksudnya untuk check sama ada jantung, masalah jantung ke tak. Okay, so kamu tengok kalau katakan tak buat saringan, tiba-tiba serangan jantung tepi jalan, jumpa Mr. Bean macam ni. So if you don't want to have this problem, so you have to do screening yearly lah. So including termasuk high blood pressure, saringan darah tinggi, kencing manis, kolesterol, and of course dengan merokok, masalah merokok jugalah. Okay. So blood pressure kami katakan kena check darah tinggi at least kekurang-kurangnya setahun sekali. Kencing manis pun sama, kalau katakan ada masalah darah tinggi ke apa-apa semua tu, you have to check frequently lah. And also cholesterol at least also annually. And also tobacco use, maksudnya kami kena mainly for doctors and nurses lah. Kalau patient datang, you have to ask lah whether do they use smoking. So ini banyak sangat, tak perlu hafal. I perlu hafal lah pasal I kerja ni setiap hari kan. So it's just for us to know umur berapa ke atas kena buat saringan apa. Yang ni mainly for our like tadi katalah darah tinggi, kencing manis, kolesterol semua tu. And salah satu yang kita katakan saluran besar dekat perut sini ada satu aortic aneurysm screening pun boleh buat untuk pesakit, biasanya lelaki lah, untuk buat scan. Okay, so yang lagi satu adalah osteoporosis and fall screening. Okay, jatuh, pesakit yang senang jatuh, ini pun kena buat saringan juga. So biasanya of course patient not falling from the sky like Mr. Bean lah, but patient can have fall inpatient, outpatient, or they can fall at home as well. So usually we will still need to screen them because it's important. And bone mineral density scan ni maksudnya untuk pesakit yang ada osteoporosis, maksudnya tulang yang repuh. For patient above 65 years old, untuk perempuan, dan men is 70 years old and above. So yang ni boleh buat saringan untuk buat scan lah, tulang scan, untuk tengok sama ada tulang tu repuh ke tak. Ada seorang patient, husband dia tolak dia sekejap je, macam ni tolak je, tangan dia dah fracture. So that's why yang tu we can see that actually sometimes tulang tu begitu rapuh, sekejap je dah fracture. So that's why we kena buat saringan lah. And of course saringan jatuh lah. This one just another banyak-banyak score lah yang kami boleh guna untuk test jatuh for patient. And of course for PPUM pun ada kami ada juga. And important untuk tanya sama ada pesakit tu biasanya buat apa kat rumah. So boleh tengok video ni. So kalau katakan pesakit ni dia memang sihat, dia boleh jalan, tengok cepat jalan dia semua tu. So important for us to ask apa yang biasanya patient buat kat rumah. So tengok patient buat macam ni. You rasa patient boleh tak yang ni dielakkan perkara ni? Boleh elakkan kan? So that's why saringan tu penting. Kami tak galakkan pesakit panjat sini, panjat sana, then dia jatuh. So it's very dangerous. So semua ni memang boleh dielakkan. Yes. So kami boleh tanyalah ibu bapa kita kat rumah atau pakcik-makcik kat sini, jangan panjat-panjat macam ni supaya semua ni memang boleh dielakkan. Kalau dah terjatuh macam ni, masalah lain akan timbul lah, nanti tulang patah semua tu. So it's actually very dangerous. So it's always important for us to ask fall screening. Okay. So yang ni pun lagi banyak lagi, sikit lagi component of functional screening among elderly. So yang tadi saya rasa Dr. Lokman, Encik Lokman sudah dah present lah macam mana kami nak buat test untuk tengok sama ada kaki kuat ke tak, the muscle strengthening, all that, untuk tengok dalam pesakit. Ini agak banyak ni mainly for doctors and nurses lah, but of course for us to know, yang tadi boleh cuba. Kalau sesiapa nak cuba pun boleh, duduk macam ni dengan tangan letak ke atas, dan cuba naik turun 5 kali. Tengok macam mana boleh buat test ini ke tak, yang tadi Encik Lokman explain tadi lah. So all this untuk check kekuatan otot-otot lah, okay. Lepas tu vision, maksudnya kalau patient tak nampak dengan terang, pun senang jatuh, senang masalah lain. That's why yang ni pun perlu kita buat saringan juga. So every elderly camp or patient sendiri pun boleh kata, complain to the doctor, katakan, oh I tak nampak dah, doktor nampak kabur, all that. So doctor will refer to eye doctor untuk buat saringan yang selanjutnya lah, supaya rawatan boleh di-startkan dengan awal. Lepas tu hearing. So tak nampak, tak dengar, all that memang risiko tinggi untuk menyebabkan patient terjatuh dengan masalah lain. Quality of life pun kurang. That's why all this can boleh minta dengan doktor untuk bagi tahu. So the easiest way to ask, do you or your family think that you have hearing loss? So kalau katakan ahli keluarga rasa you dah ada masalah hearing loss, or you sendiri rasa ada masalah pendengaran yang teruk, boleh minta dengan doktor, bagi tahu doktor, doktor boleh buat saringan dengan rawatan yang awal lah. Okay. Kecuali kalau boleh dengar macam ni, teddy bear pun boleh dengar, dan yang tu memang baguslah hearing. Okay. Alright. So the other thing will be oral health. Kalau katakan macam gigi palsu ke, gusi ke, masalah oral health yang dalam mulut tu ada masalah-masalah lain, yang ni pun boleh bagi tahu doktor juga. So kena jumpa dentist lah. Sorry, I use a lot of Mr. Bean photo because it's very funny, just to make it interactive. Okay. And then of course continence. Kalau katakan ada masalah kencing, batuk-batuk atau bersin, air kencing terkeluar ke, atau tak boleh nak tahan air kencing, semua tu, all this pun masalah older people as well. So yang ni pun boleh minta bagi tahu doktor untuk startkan rawatan awal. And the other thing will be, yang ni selalu benda yang dilupakan, maksudnya mood. Sama ada perasaan makcik-pakcik macam mana. Sama ada you rasa sangat sedih, sangat depressed, all this is actually we do have treatment, ada rawatan, saringan pun boleh buatkan, rawatan pun boleh startkan awal juga. Especially for depression screening, we use Geriatric depression scale, okay, to test for the patient. And connection maksudnya tahap kami katakan connective, whether the patient have connective impairment or not. So far banyak guideline yang katakan kami tak galakkan untuk buat saringan setakat ni. But of course kalau patient datang dengan komplain, katakan dia ada masalah tumpuan perhatian yang kurang ke, atau tak berapa alert semua tu, memang kena I mean have to do screening and also start treatment lah. Okay. So the last one is elderly abuse and neglect. So sometimes yang ni kami rasa macam tak pun benda yang selalu dilupakan. Whether apa tu elderly abuse, maksudnya kalau katakan anak-anak ke atau penjaga, kami katakan physical abuse, pukul ke, hantam ke, all that. So it's actually part of the abuse. And also of course psychological, emotional, marah-marah, and then kurungkan kat rumah, tak bagi keluar, tak bagi duit, tak bagi makan, semuanya adalah salah satu abuse lah. So kalau katakan for of course for us yang I mean doctors or nurses, kalau katakan if you see patient do have some certain physical signs, then you boleh ask in further. Some guideline kata boleh buat saringan, some guideline kata tak ada, tak payah buat. But of course if you find that there is some physical sign, kalau katakan ada nampak macam pesakit tu nampak tak sihat sangat, nampak macam ada banyak-banyak lebam-lebam semua tu, kita risaulah, mungkin anak dia pukul dia ke, tapi dia tak berani nak kata semua tu. So all this as a healthcare provider kami kena detect, and then we have to do saringan awal dan startkan rawatan awal lah untuk selamatkan pesakit-pesakit. Okay, atau dia tak sempat nak makan ubat, tak ada orang jaga kat rumah, all that. So those are actually part of the neglect and abuse. Okay, so masa pun suntuk, I just want to bring the take home message. So saringan in older people should not only focus on mortality outcome, but on function and health related quality of life. Maksudnya kami buat saringan bukan setakatnya untuk kurangkan kematian ke atau kurangkan keterukan setengah penyakit, but it's also important for us to have like quality of life. Maksudnya we want to make sure that the patient ada bagus quality of life. Dia boleh hidup dengan happy, dia boleh hidup dengan enjoy the rest of their life, macam tu. So it should be individualized, and also kena tengoklah sama ada kalau dia ada, they do have other comorbidities. Kalau katakan pesakit tu ada banyak masalah kesihatan yang lain-lain, atau dia dah dah ada pernah stroke, dia lantar dekat katil, tak boleh gerak semua tu. Sometimes sesetengah saringan pun tak berapa sesuai untuk pesakit tertentu lah. So that's why yang ni penting juga kami untuk tengok on this part. And of course, older individuals should be made aware of the potential benefits and harms of screening. Kalau katakan doktor minta makcik-pakcik buat saringan tertentu, macam nak buat test ni, buat test tu, yang ni biasanya doktor atau nurses kena bagi tahulah test tu untuk apa, untuk buat berapa lama. Kalau test tu positif, nampak ada benda ni, nak buat macam mana, rawatan apa. So all this supposed to be counseled and also explained by the doctors to the patient lah. Kalau tak tu, kalau katakan test-test yang mahal-mahal pula, nanti pakcik-makcik pergi buat dan lepas tu dapat tahu ada masalah ni, tak tahu apa nak buat pula. So all this is supposed to be discussed and also individualized for our patients lah. Yeah, okay. So with that, thank you very much. Ada apa-apa soalan boleh tanya lah. Alright. Very fast, 20 minutes gone already. Okay, yeah. Ada apa-apa nak tanya tentang saringan ke, atau macam mana nak buat saringan tu, nak minta dari doktor mana, nak buat dekat mana. All this can if you want to know, can ask us lah, ask me also can. Yeah. Okay, can. Yeah, thank you very much. Oh, very scared.
No, just personal experience lah. I had an older relative went for this screening stuff lah, and then found things that they probably wouldn't find if she never went for screening. Then end up stress, and stress, and stress. So sometimes screenings can have problems as well lah. So how would you counsel the pros and cons for all this lah?
Okay.
Because unnecessary anxiety is also a real problem lah. Because screening also quite expensive lah.
Okay, yeah, it's a very good question. So whether so Dr. Terence tanya, Dr. Ong tanya, sama ada some patient kalau pergi buat saringan, lepas dah tahu saringan tu ada masalah tertentu, penyakit tertentu, dia rasa stres pula, rasa sedih pula. So what is the risk and benefit? So that's why biasanya kami katakan, we have to explain to the patient before buat screening. Some patient memang dia tak nak. I pun pernah cuba, kalau counsel my patient, I kata, nak buat test ni ke tak? Nak buat test tu ke tak? Kalau dapat ni, boleh tahu sama ada cancer ke, ada masalah lain ke. Lepas tu rawatan boleh start awal. Tapi banyak patient dia, sometimes dia orang tak nak. Yang rasa, I tak nak tahulah, I just leave it, I just don't want to know. So kami kena bagi tahu sama ada, okay, kalau katakan dah buat test ini, and then dah positif, apa rawatan dan apa step-step yang seterusnya. So whether, of course, patient must understand, and of course they have to try to overcome the stress. If they think that they cannot overcome it very well, and they don't have a very good family support or support, background, social history or support is not good, sometimes screening can cause more harm, like you said, anxiety, all that. So for those patients, sometimes we can't really do screening for them. If they really don't want, we can't force them. Yeah, that's why shared decision making is important. Yeah. Yeah. Can?
This is my first time here.
Okay.
How do we go about to go through the stages of registering and you know?
Okay.
Because my first time here, I would like to know more.
Oh,
about
okay,
the,
good.
Geriatric department.
Yeah, okay. So for screening, because I'm from family medicine department, so for screening, kalau pernah dengar RUKA tak? RUKA. The Rawatan Utama Klinik So we have it in nearby the pharmacy there. Ni macam promote klinik saya dah. So we do have this clinic beside the pharmacy, ground floor dekat bawah sana. So kalau katakan puan memang rasa nak buat saringan yang tertentu, mana-mana which one that you feel like you want to do, you can, kami do have this one appointment based clinic. Boleh book online. Lepas tu datang je pagi. Maksudnya dah book online, then datang untuk hari yang booking tu lah untuk buat saringan. Boleh minta dengan doktor untuk tanyalah apa saringan yang sesuai untuk puan atau encik. And then doktor biasanya akan bagi appointment. Because sometimes saringan semua tu macam scan ke mammogram semua tu, dia pun ambil masa sikit lah. Pasal banyak patient juga kan. So dia perlu temu janji juga. Dia bukan buat on the spot, on the same day, bukan. Ya. Yeah. Yes, memang kena register dulu. Maksudnya yang tadi yang appointment based clinic tu boleh register online. Lepas online, let's say kalau katakan pun nak datang esok pagi, so you register today untuk jumpa esok pagi. So lepas tu datang esok pagi pergi kat klinik Ruka. So you just ambil nombor, katakan dah register, ambil nombor. Lepas tu pendaftaran, tengok nak bayar ke tak, sama ada pensioner or not. Then after that kalau perlu bayar pembayaran, lepas tu boleh terus jumpa doktor after that. When you see the doctor, then you boleh bincang lah apa yang puan nak, semua tu, screening ke, saringan ke, macam mana. Then doktor, kalau doktor rasa perlu buat semua ni, doktor akan bagi temu janji lah untuk buat test-test tertentu. So still have to register and jumpa doktor dulu. Yeah. Ruka, yes, go to Ruka first. Because screening maksudnya puan well lah, tak ada tanda-tanda apa-apa, tak ada symptoms lain. So maksudnya that's why kami buat saringan. Yang tu biasanya tak terus pergi specialist lah. Kami pun specialist juga, but we do health screening for patient also lah. Kalau katakan you rasa sini jauh, you don't want to come to Ruka, tengok puan tinggal kat mana. Tahu tak apa tu klinik kesihatan? Yang bayar RM1 tu, so if let's say you go to klinik kesihatan, you can do all these tests as well. They will refer to the nearest hospital. Macam KKL, boleh refer kepada HKL. So banyak hospital kerajaan pun ada buat test-test tertentu juga. So pun boleh juga. Tak semestinya datang Ruka. Geriatrik klinik. Yang tu untuk kami katakan memang specialist klinik khas untuk pesakit yang above 65 years old lah. So biasanya dia orang ada masalah yang lebih kompleks lah. Maksudnya maybe more than few medical problems, ada banyak kencemani darah tinggi, semua penyakit. So those patient yang kami rasa spesifik untuk jumpa patient dekat sana. Then kami akan refer patient, maksudnya dari Ruka kami akan tuliskan surat rujukan untuk pergi kat geriatrik klinik. But let's say untuk saringan tertentu sahaja, memang tak perlu pergi geriatrik klinik. We family medicine specialist pun boleh buat. Tak perlu. It's not like that. Because primary care, we do have a lot of patient like for elderly people, from baby to for elderly people. Memang we can see a lot of patient. Different age group of patient. So untuk saringan biasa, memang is under primary care. In other country pun sama. Kalau saringan memang is under primary care. Unless for geriatric clinic is only for those yang macam kami katalah yang ada masalah kompleks sikit, yang perlukan rawatan seterusnya dari specialist pakar geriatrician lah. So actually it's good, means that you tak ada masalah lain, so you don't need to see the geriatrician yet, unless you have other more complex problem. So do screening early, then you can prevent that happen. Okay, thank you for your question.
Okay, thank you very much, Dr. Beh. Apart from health screening, supplements can also be quite expensive. So these days, particularly in the era of social media, we see a lot of advertisements encouraging supplement consumption. So is this a requirement for older people? To answer this question, we have Ms. Chaw Lai to deliver our next talk. Ms. Chaw is a pharmacist with over 11 years of experience serving in Malaysia and in the UK. She is currently the pharmacist in charge in Caring Pharmacy Subang Parade Mall. As the moderator for the talk, we would also like to invite Ms. Mary Lee Hongyi from Department of Clinical Pharmacy and Pharmacy Practice, Faculty of Pharmacy UM. Ms. Mary is a member of pharmacy professional bodies in Australia and Singapore and is currently a member of Malaysian Pharmacy Society. They will both deliver a talk entitled What We Need to Know Before Taking Supplements. Welcome.
Okay, good. I think almost still morning. Okay, good morning to all the ladies and gentlemen. I'd like to thank the organizing committees for giving me and also Ms. Chaw a chance to have a talk about this topic, about what I need to know before you take the supplements. Okay. Okay. Also, I want to say hello to those who are online. Thank you for attending this talk and hope that you get more information from us and also the other speakers. Hold on. Okay, so what is health supplements? It's actually a diet supplement. Okay, so is it done yet? Oh, okay. We wait a while. Ini dah. No.
No. Plug tak on over there.
Plug rosak.
This one rosak. Be careful Okay, jadi.
Okay, I think it's okay. We can continue. Yeah, as we go along, they will adjust the light. Okay, just all these supplements based on FDA, it says that it is supposed to add in or supplement our diet. Okay, it's supposed to help to either improve or maintain our health, or just to boost it up, and to also enable the supplements to meet our daily requirements of essential nutrients. But it's not supposed to replace food. Okay, it comes in many forms, like tablet, you have it in capsule form, and soft gel, and also some in bars or gummy bear kind of look, and also liquid. Okay, and whenever you look at the supplements, you have to make sure that it actually contains the label that lists down all the ingredients and also the content, its content. They also have to teach you how to take the supplements. Okay. So that is essential, important, and also usually you label as this is for dietary supplements. Okay, it's not for treating diseases. Okay, what is health supplements? You know, they actually the general one we know is the vitamins and mineral. Vitamins comes in vitamin A, D, E, K, B, and C. So generally, this A, D, E, K is those supplements, vitamins that can dissolve in oil. And also the B and the C, and B complex and C is those that actually can dissolve in water. Well, for the minerals, the common one, calcium, okay, you have iron, and then zinc, chromium, selenium. All these you can actually get some find it on a shelf, the supplement shelves. Other than vitamins and minerals, you also can find health supplements in a plant extract or herbal extract form, such as echinacea or even ginger. Okay, and then what about animal source? You can also find all those supplements that extract from animal. The common one is fish oil. Okay, and then sometimes you'll find some amino acid, very unique supplements, essential for our body. Okay, and one of the very common one nowadays, you'll hear a lot of people are taking these. These are the probiotics. They actually come from the live microbiomes. Okay, so as a pharmacist, Ms. Chaw is seeing and encountering a lot of these conditions. Maybe I will now pass the time to her for her to tell us more about what are the age-related conditions that the elderly face at her workplace.
Hi, good afternoon, everybody. I think it's, 10 minutes. So these are just a summary of the conditions that we usually come across in the pharmacy setting. Actually, I'm not going to go into much details because some of the speakers already covered previously. But as you can see here, most of the time, you can hear like a lot of patients, they will say, oh, I feel really tired. I don't have much energy to do what I want to do. Some will just say, oh, really sakit sini, sakit sana. Can you recommend something? Usually, it happens around the joints and the back. And many also will complain that get a bit forgetful. A bit like confused sometimes, and in some serious cases, some actually develop dementia, which is a complete memory loss. But this is usually the case in the Alzheimer's. Also, we can see many actually been diagnosed with heart disease, including blood pressure, osteoporosis, and in particularly in women. And they are also more vulnerable to infections because of a weaker immune system. And actually, a smaller number of older people, they actually become so weak, and they can fall easily, and therefore, you can see they rely on certain supports like walking sticks. Some actually suffer from neurological conditions such as stroke, Parkinson's disease, and therefore they can barely walk or they might be housebound. Sadly, there is some complaint they have weak bladder control, and some even lose their vision or hearing at the later stage. And this is the point where they feel more vulnerable and sometimes get a bit agitated. But nevertheless, we are only human, and aging is a life process, isn't it? However, we still need to remember that aging itself is not an illness. Okay, we have a very good example here, which is Dr. Dun M. Actually, our previous speaker, Lokman, already covered, and then but we just need to. I just want to say that it's really amazing that he still keeps so active and healthy at his age. So I have the next slide relate to Dr. M as well. So I don't know whether anybody has come across this picture before. Has anybody ever noticed what is lying on the table there? So I'm not sure when and how this picture was taken, but it was so viral on the internet a few years back, and it was even used by one of the pharmacies to promote this supplement. So I'm not here to promote anything, including this supplement. The reason I'm bringing out this picture is that just want to say that sometimes people do choose a supplement based on celebrity effect. In fact, this supplement was so popular that it even sold out in most pharmacies at that one point. So the question for you all is, are we really choosing based on what you need, or you are actually following the trend? So what makes you choose a supplement? Okay.
Anyone remember these pictures? I think almost 4 years ago already, or more than that. Yeah, it's just amazing. Just one pictures, I really make this miracle out of stock. Remember? Yeah. So just now, Miss Chaw said, there's a. You sometimes eat good, you follow friends, you follow advertisement. Oh, take this good, take that good. Hey, what about me? Is it really good for me? Hey, Miss Chaw, can you tell me more?
Right. So. It's a very good question, Ms. Lee. So there are a few things that we usually check with the patient. Oh, sorry, I'll go slower. Okay, so there are a few things that we do check with the patient before we suggest any supplements to patient. So in the pharmacy, the first thing we usually will ask is, are you actually having any symptoms currently? So this is the most important step, because it helps us to take all the necessary information down before we can decide what's the best for you all. And then if a patient does have the symptoms, we usually check how long have you had it and how often do you have it. And then the next thing we'll check also, have you tried anything yet to resolve the symptoms? Over here, it's not necessarily just a supplement. It could be any medication they try to take to resolve it. And if they have tried something, we also ask them if there is any improvement they notice, and if not, what makes them stop? Is that because of difficult to take? What's the reason behind the not complying? Okay. So also secondly, after checking the current and past medical history, we also check the lifestyle and social history. The previous speakers actually covered a lot, so I'm not going to go much details. But usually we will just check whether the patient eat healthily. Do they actually have a variety of fruits and veggies? Do they actually stick to suku separuh diet recommendation? And then sometimes we do check whether they are living by themselves, because these are the group that they usually tend to stick to the same diet all the time, or maybe a bit blunt diet. Sometimes they might have like a bit poor appetite, or even might have dental or biting issue. So they might not, be able to actually have a wider choice of the food. And then we also check if they stay active as well. So here we're not going to say that we expect people to go to treadmill and run for half an hour. So it's just maybe a simple walk for half an hour a day. And then we also check whether the patient is a smoker or drinker, and then whether they're stressed with something, whether they have any trouble with sleep. Okay, so after the two factors, then we will try to make the recommendation. So from the patient history taking, we will identify whether there's a short-term need or long-term health need. Usually we will prioritize to recommend something to relieve the short-term health issue first. Then only we also we will check to resolve the long-term health issue. And then at the same time, we will have to make sure a supplement is safe and effective for the patient. What I mean safe here is that we usually check whether a supplement interacts with something they are taking already. And then to ensure the effectiveness, we will ensure or invite the customer or patient come back and review the usage of supplement maybe in 3 months' time.
Wait. A lot of information here. I'm overflow all this, all the notes and info. I think too complex. Why don't we try to use some live scenario to see whether we can digest all this slightly better. Let's say there's one man around 65 years old, come to, let's say, to Miss Chaw, and he say, I need some supplements, and then I want to feel better. Then he say, oh, I don't have any sickness, it's just a bit pain here, there, and then also a bit tired. Any supplements? So far he hasn't been taking any supplement. Miss Chaw, if you see a customer like this, what would you do?
Okay, so this, thank you, Miss Lee. This is a very interesting case. Okay, so we see this kind of scenario from day-to-day basis. Usually, I can hear. Oh, okay, sorry. So over here, you can see that this gentleman, 65-year-old, he hasn't got any major illness. So usually we were not expecting he's on any long-term medication. However, he has aches and pains. So we can identify from here, actually there's a short-term goal, which is the aches and pains that he might want to resolve. And the long-term goal is because he feels tired, he wants something to boost up energy. So, right. So we will actually, in order to assess the need and suitability, we, as I say, we have to ask a few more questions from the patient. So we actually need to work out the actual root cause of tiredness. Because he has aches and pains, we have to check whether he self-medicate with maybe some painkillers as well. Because sometimes the tiredness, not necessarily because of lack of energy, it could be the aches and pains that result in the poor quality of life. And then we also have to move on to check his lifestyle, as mentioned earlier on, whether he eats properly, whether he stays active, and any sleep issue, because all this can contribute to the lack of energy. And this wasn't mentioned in the case study earlier on, so we have to check. And then we have to make the recommendation afterwards based on what we know, what we have the information. So usually we recommend, we will check whether what is the budget of the patient or customer. And then we also check whether they are the type that they can forget the supplement, and then we try to check, whether they really can comply. So after the recommendation, we will ask them to come back, usually in 3 months' time. So I'm just showing a few examples in this case, maybe. So for the energy and vitality, usually the common examples are multivitamins, vitamin B complex, CoQ10, ginseng, tonka ali. Whereas for aches and pains, the common examples would be turmeric, glucosamine, and collagen type 2, which is quite popular, especially for the joint pain nowadays.
Wow, it's not that easy just to find supplements for a special person. Quite a lot. Can you all catch or not? All this? Yeah, not really. Maybe sometimes we do not get all the customer that's so straightforward, healthy one, and just want something to boost up energy. Sometimes there are certain customer comes in for a very specific request. Let's say this lady, okay, but how old this girl? This lady. Okay, 68 years old, came to Miss Chaw and says that I always forget things, poor memory. And she's worried because the mother had Alzheimer's disease before, and she's worried that she will get it. She's overall healthy, but just this poor memory keep disturbing her. And then after check a bit, then she's actually quite healthy, only have diabetes, but it's a well-controlled diabetes. Ms. Chaw, how to help her?
Right, thank you, Ms. Lee, again. So this is another very popular example. A lot of older people, they will come and ask for the similar, the supplement for similar condition as well. So going back to this case, this lady, she has a well-controlled diabetes, and she's just after something to improve her memory. So in this case scenario, we can only tell that she only has a long-term health need to address, not any short-term goal. So whenever a patient or customer comes to pharmacy and requests for supplement to boost the memory, usually the first thing that comes to my mind will be the ginkgo. So what is actually ginkgo? Ginkgo is actually the herbal extract from dry leaves from the ginkgo biloba tree. it is actually an antioxidant. It helps to improve the blood flow around the brain area and may stop some abnormal growth in the brain, and therefore it can help to delay the dementia and the cognitive impairment. The current recommended dosage of the ginkgo is actually 120 to 240 milligram daily in divided doses. However, ginkgo, it comes in a few different types of formulations. For example, the crude and versus the extract formulation, which I'm going to touch on my next slide as well. And then I also need to highlight here that most supplements, it does take time to work. Like in ginkgo itself, the case, it can take sometimes 4 weeks and up to 6 months to work, and it depends on the individual response. And a lot of people, they sometimes, when they buy supplements, they forget about the drug-herbal interaction. For like example, in this case, ginkgo, it does interact with anticoagulant. So imagine if you're taking two together, it can actually increase the chance of internal bleeding. Therefore, we don't recommend if we found out they're actually on that, and we do really advise them to see their own doctor or pharmacist. However, in this case scenario, this lady, she only has a well-controlled diabetes and shouldn't be on any anticoagulant, so it should be quite safe for her. So, as I said earlier on, ginkgo biloba, it comes in different formulation. This is just an extra note to show you how that we should really read the product label. As you can see here, I found one of the brands it mentions is high-strength ginkgo biloba, 2,000 milligram. However, when I read the product carefully, you can only see that from the 2,000 milligram dry leaves, it only contains 40 milligram per tablet, and hence the dosage of 1 tablet 3 times a day. Right, and I'm going to show you the next comparison. There's another brand here. It says extra strength ginkgo, and it's only 120 milligram down at the bottom. It sounds not a lot, right, compared to 2,000 milligram. However, when you read the supplement facts, the ginkgo biloba also 120 milligram, and hence the dosage of 1 daily. So my question here is that which brand do you think is really high strength as it claimed now? The reason I'm bringing out is because some people, they would actually assume that one supplement is high strength, and then they would try to modify the dosage themselves. Instead of like maybe taking 1 3 times a day, they will just decide to reduce to 1 daily. And then they might come back to you and say, oh, this supplement is not really working for me. And then when you ask them, if you only reduce to 1 daily dosage, obviously you might not achieve the maximum benefit. And hence it's quite important to read the product label and understand what you're actually taking in order to make a wiser choice.
Wow. Read the labels also itself is important. Anybody actually, when I look at the 2,000 milligram, is it very like high dose, very potent, very big, and concentrate, and very good product or not? Do you think that way or not? Okay, so next time be careful. You have to actually look in details. That's why I said just now the labeling, you must actually list down all the content, and also list out the ingredients and also the strength, the content. And then, so if you don't understand all this label, always get some explanation from the pharmacist. Okay. So what about, there is another case, you know. This gentleman say, hey, I've heard a friend says this red yeast rice, very good. It can help to reduce my cholesterol. This man actually had cholesterol, high cholesterol for 10 years. It's on this cholesterol medicine called simvastatin. And he said, hey, can I just take this red yeast rice, and I don't want to take medicine. So we come to Miss Chaw. Miss Chaw, hey, tell me more about this red yeast rice. Can I replace this with my cholesterol tablets?
Right. So I'm quite glad that this scenario is here because it just happened in my pharmacy 2 days ago. So why red yeast rice is so popular nowadays? Because it is clinically proven to reduce the cholesterol. Actually, it contains a natural compound called monacolin K. And this is actually quite similar to a well-established cholesterol tablet in the market called lovastatin. In this case, this gentleman, he said he wants to replace the cholesterol tablet with the red yeast rice. However, we will actually need to check why he was on the cholesterol tablet a few years back because he's already on that for 10 years. So if he had a bypass or heart surgery, it's definitely a no-no that we actually convert anything to a natural therapy. You usually will say, in this case, you need to speak to your doctor, or we usually have to refer them back. I'm just highlighting the interaction here because a lot of people, they buy the supplement themselves before they even asking. So imagine you're taking these two together. The chances are you are actually getting the side effect of statin. You could have muscle pain, tiredness, because these are all the statin side effects. And so if you are really on the statin already, red yeast rice definitely not suitable. There will be some alternatives such as oat beta-glucan or even some probiotics in the market. And we also will suggest some CoQ10 to reduce the chances of getting the statin side effects. We only recommend the red yeast rice for anybody that has borderline high cholesterol. And then we also recommend alongside with the lifestyle changes. For anybody that's definitely have high cholesterol and a high level LDL, you always need to speak to your doctor. Okay.
Oh, I always thought supplements or all this herbal is safe. Oh, I didn't realize that actually they are something like very near and close to the action of a medicine. If I don't know this, if I take this 2 times, that means I double the dose of the medicine, and I get all the side effects. So I think, yeah, I better be careful next time to seek some more advice from Ms. Chaw. Okay, due to time constraint, I can only bring 3 cases to you. Okay, maybe we will let Ms. Chaw give us some word of advice before we end this talk.
All right, so our take-home messages today are, before you decide to take any of the supplements, please consult your own doctors, your pharmacist or dietitian. Also be wary of some drug herbal interactions as well, because sometimes it's easy to underestimate the risk of taking a supplement. And definitely try not to replace any of your long-term medication with supplements without any advice. And make sure you understand the product. Read your leaflet or read the product carefully before you start taking. And obviously, try to review the usage regularly because our need may change from time to time. Okay, thank you.
Your need change from time to time. So doctors, pharmacists, dietitians are always here to help you and guide you to get the best and the correct or the most suitable supplements for you all. Okay, with that, I want to thank you for paying attention to our talk and thank you for this opportunity again. And thanks, Ms. Chaw.
Thank you
for sharing. Now is the question answer time. Pass it to the MC.
Yeah, thank you so much for the nice presentation because the patient always come to us, ni boleh makan tak, ni boleh makan tak. So sometimes we might not really know about supplement because it's not really covered in our medical school last time. So I'm just wondering whether is there any website, like reliable website for the doctors to actually check whether all these supplements are really like safe or at least some approval from the national or something, yeah.
If you're really after the referral, usually we will, it depends on what references you have because means they don't really cover a lot. Sometimes you can look at the stocks list, drug interaction, or you can look up the BNF, sometimes they do mention as well. Usually are the 2 sources that I use to look at. Also sometimes the product leaflet also it will cover as well. They will cover like what precautions and warning. So if it clash like according to manufacturer's recommendation, we would not to recommend as well.
But like the one you mentioned, the red yeast rice with cholesterol,
it is on the product label.
It is product on the label. The big piece of paper. I have to read
it's actually
that.
on the outer box if you read it carefully.
I see. Okay. And also, just wondering another question. Like let's say for ginkgo and memory impairment, those kind of things, we always heard about it. So let's say some patient they come with all these supplements. Do we need to because for me, I always go back to search for systematic review or meta-analysis so that before I say yes to the patient. So is there any other shortcut way or faster way for us to actually identify whether this supplement is good for certain diseases, whether it's evidence-based or not? Yeah, thank you.
Okay, that is a very interesting and good question actually from Doctor. Okay, unfortunately in the market, right, a lot of supplements, they are actually, I would say they are based on case studies and a lot of, unless it's very long and well-established supplements such as like fish oil, and ginkgo actually has been studied, like red yeast rice as well. These are the very popular one. However, I'm not saying like the supplements that are not effective, but it's just the amount of trials, because sometimes the manufacturers, they wouldn't really spend like thousands of money just to trial one thing, but it nevertheless is still effective, because this is why we always invite the customers to come back, because sometimes one supplement suitable for you not necessarily suitable for the next person. So this is quite important. We have to address to them, we manage their expectation, because supplement, it takes time. It's not overnight thing like, like medicine, it works quickly. So we are still hoping to see more studies being done, but obviously it depends on how much budget they have behind the research. I hope that answers your question. Okay. Any more?
The effect or side effect. Maybe you can touch a bit on that. Thank you.
Sorry, you say the effect or side effect of supplements, or?
Side effect of medicine, basically. Some of the statin, example.
All right. So you want me to explain further on the side effects of the statin? All right, okay. So if we going back to the case scenario, the reason I bring that up is because some people, they choose to take the red yeast rice with the statin before they consult, and if you're only taking the statin alone, the chances is not as high compared to those who actually try to self-prescribe with something else. So although the chances of the starting with the side effects is not high, it still happen. I'm not saying it's is 100% free of side effects. If you look at the literature, statin, it can cause like certain side effects such as like muscle pain and tiredness, because it can reduce the CoQ10 in the body as well, so people can feel a bit tired. But with the unfortunately, there's a very, very small percentage. Some people have the muscle ache, which is more which is like irreversible because of the muscle waste in the body. But I'm not trying to discourage people from taking the medicines. It's just one of those things that might happen, but we need to be aware so that we can actually seek medical help as early as possible, because there are a lot of more medications that might be more suitable for you. So, is that will that help? I hope that answers your question. Okay, but I was, yeah, it is a very common medication. It's a very common medication, and some people been prescribed as a preventative sample. But I would definitely advise you to go back to your doctor and have further discussion about tablet, and try to read through the information leaflet to understand it completely, and list down all the questions you have for them. Okay.
Thank you, Ms. Chaw and Ms. Mary, for the informative talk. Our last talk for today revolves around a particularly interesting topic. The only speaker with non-healthcare background, Mr. Chandrasekaran Velu, is a banker with over 27 years of experience. His field of expertise is on financial investigation techniques and procedures, which won him awards from the Royal Police of Malaysia for his help in combating commercial crime cases. He is currently the head of fraud risk management and authorization in Standard Chartered Bank Malaysia, and he has generously made the time today to talk us on keeping safe and avoiding financial scams. Welcome, Mr. Chandrasekaran.
Hi everyone, good afternoon to all of you. Thanks for inviting me for this session. It's my pleasure to be here. So again, let me introduce myself. My name is Chandrasekharan Velu. All right. Basically, I'm heading the fraud risk management in Standard Chartered Bank. Okay. So the objective I'm here today, basically to present a session with all of you regards to fraud awareness, right? So looking at currently on the scams and the frauds that's happening, right? I think most of you have heard about daily in the news, right, in the media, where you're hearing about people fell into scams, fraud attempts, and they're losing their money, right? So of course we as a financial institution and also a Bank Negara Malaysia, all right, we together work towards combating this fraud that's currently at a hub trend, I would say, looking at the scams that's happening via social engineering. Okay, so with that, I'd like to begin the session. Just go through with you a few slides explaining to you what kind of fraud that we are looking at today, right? Okay, so if you can see on this slide, right, I would say for the last 2 years, right, in Malaysia, right, it was reported about 51,000 cases, right, with a total losses of 1.6 billion. People lost their money, all right? And according to the 2021 scam statistics, and estimated 90% of all these data breaches happened because of fear of phishing emails, right? So I will touch in more details on the phishing emails on the following slide. Okay, so out of 81% of people who have engaged with the scam websites, I would say 50% of them say they have lost their money. So that shows the impact. From here you can see from the statistics, right, how big is the impact in terms of the losses to the public, to the people losing their money on the scams. Okay, so here I would like to a bit deep dive what sort of scams that we are looking at here. Okay, so mainly there are three types of social engineering scams that we are looking at. The first one is phishing. So what is phishing? So phishing is basically where the scammers, right, the fraudster, they will send an email to an individual impersonating as an organization or a certain body, right, or certain entity, right. They impersonate and they will try to get your attraction, all right, where they will send some kind of message to you via email, okay, and they will expecting some kind of action from you. For a good example, I would say, they will send an email impersonating like sending from the bank, right, saying your account has been freeze for a reason they need to do some validation for security reason. See, they are very smart. The way they worded the email, right, as though they are, just as I mentioned, right, to get your attention, right. So they put up as though they are there to help you, all right. As a bank, they're sending you a message and they try to help you, and they need a cooperation from you, all right. So what happens here is in that same email, right, they will basically they will give a link, all right. So they said you need to click to the particular link to validate your personal details, right? So then what you did is you click to the particular link. So when you click to the link, then it will bring to a fake website, okay? It's a fake website which looks similar to how today's the bank's website looks, okay? Because for the fact the scammers also know, because they also explore to the websites, so they know how the bank's website looks like, all right? So they will create a fake website which looks similar to the bank's website, all right? But of course, there are certain features that in the website, if you look at the actual website, for example, the padlock, all right? If you log into by Google, right? If you log into the bank's website, right? So you'll be able to see a padlock there, right, on the top. right? So that is one key element that you actually can confirm whether this website is a legitimate website or not, right? But in the fake website, they don't have that. Okay, so that's one of the things that you can look out for, all right? So in the modus operandi of this phishing scam is basically, as I mentioned, they give you a link for you to click. When you click to the link, it will bring you to the fake website, which looks like similar to the bank's website. So now what happens here is you think that is like similar like the bank's website, you log in, right? So you put in your username and password, all right? The moment you put your username and password, so what happens here in the fake website, basically it's like a mirror for them. We call it, in our fraud term, it's a man in the middle attack, all right? So when you go into this fake website, when you're putting up your information, they will be able to see it. For them, it's like a mirror. So once they see your information that you're keying into the system, right, to their website, right, at a real time, they will misuse of that particular information. They will log into the particular bank's website. For in this instance, for example, Standard Chartered Bank, right? So you have an account with Standard Chartered Bank. So they will may send to you with the logo with Standard Chartered Bank, right? And you think, yeah, I'm having an account with Standard Chartered Bank. Oh no, actually Standard Chartered Bank is the one really communicating with me, and I need to validate my information. Otherwise, I'll not be able to use my account. So you will get panic, right? So I want to cooperate, all right? So then you click to the link and you put all the information. As I mentioned earlier, they'll be able to get your particulars from there, and they will go to the actual bank's website and they will perform a transaction. They try to go into your account to view your account, and thereafter they would like to do an attempt, right? So when they go in, of course, today the banks have the securities in place, right? So it's not to the extent of just putting a username and password. You can go in and view the account and transfer the money. The answer is no. To the banks, security is very tight, I would say. So we have multiple layer of securities authentication that you have to go through, right? As I think most of you have already experienced today, right? When you log into your bank's website, right? So the other element that is required is OTP. Some, if you look, I think, I won't say some, most of the banks today, they have their images, security images, right? So today that images that you choose, what image that you prefer, right? So that image will appear, right? So when you choose that particular image, then only you can log into the following page, right? This is in the real, actual website of the bank, right? But in the fake website, they only ask you 3 things only. They will ask you username, password, and the OTP. Okay, now here, how the OTP goes out. Okay, in the normal circumstances, right, when you log into a bank's website, in actual genuine transaction you want to perform, right, when you put your username and password, of course, the message goes to the bank's server. It will reach out to the bank, all right? So then what the bank does is, the bank have all your information, all right, such as your email address, such as your mobile number, right? So what the bank does is, the bank will generate. So now the bank get a message, right, that you have logged into the bank's server. So the bank will generate an OTP, right? So that particular OTP, the 6-digit number, right, will send to your registered mobile number, not to any other party, right? All of you have registered. When you open an account, you have to register, right, your particular personal details, right? So your key elements is the mobile number, right, to interact with the bank. So that is a mobile number the bank sent out the OTP. So when the bank generate the OTP, right, by SMS, you receive, and in this particular modus operandi, right, when you receive, actually the fraudster already got the 2 element, right, username, password. So that what are you putting in? They are now waiting for the OTP. They are waiting for the OTP from you, right? So when they go into the actual bank's website, the bank now generate OTP ready, right? So the OTP will send to whom? Is it to the fraudster directly? The answer is no. They won't send to the fraudster because the bank don't have the fraudster's number, right? The bank has the customer's phone number. So here what happens, the OTP will be sent to the customer. So when the customer receives the OTP, here what happens? The poor customer, all right? Here thinking that he's interacting with the bank, but in actual fact he's interacting with the fraudster, right? So when he receives the OTP, he basically put that OTP into that particular website. And the fraudster is very smart. As I mentioned earlier, right? They create a similar website, fake website, which looks like a bank's website. But the only thing is, of course, as I mentioned, the image won't be there. All right? So that's how you need to catch whether it's a fake website or legitimate website, and the padlock, as I mentioned earlier. So if you really can look out for this, you can stop immediately. Hey, this is not the right website, right? But in the most of the case that we have seen, right, the victims basically, they realize. They don't look at these particular elements, right? So they immediately, because they want to quick kill on that particular action, right? Because they will be busy with other stuff or what, when suddenly they see the email, so they panic. They want to just quickly get out of it, right? So they follow the flow. So now what happened, the OTP sent, they see the OTP, they put OTP. So again, as I mentioned earlier, it's like a mirror for the scammers. You're putting the OTP into their website, they take that 6-digit OTP, now they immediately put into your bank's website. Now what happened? They can go into the account and they can transfer. They can transfer the money out from the account. So this is where mostly you can see the scams that's happening. Right? That's why people are losing their money. Right? Okay, so that's on the phishing. Now, what is vishing? Vishing is where, similar like phishing, but phishing via email. Now this is via call. They impersonate, they are calling from, example, PDRM, LHDN, Mahkamah. They said you have a case. This and that. A lot of things you have heard about, right? Today you have, in media, news, you have heard about all this. So they will impersonate as such authorities, and then they said you need to cooperate with them. They put a fear to you. So when they put a fear to you, what happened? You just follow. All right, when you follow, and then you give away all your information to them. So in this case, you're giving away the information as compared to the earlier one. You're going to click to the link, you log in, and you're putting in here. All right, so this MO on the phishing side is where, phishing is where when they call, they ask you for information. They say they need for investigation. So when you give away, they will misuse of this. Again, the same way. All right, and the next one, smishing. So smishing also, I will say similar. All right, but here is by SMS. One good example, I would say, you receive, you are a Lazada, a loyal customer, right? So they will send, like a Shopee. So a lot of people do online Shopee, right? E-commerce purchase, right? So they will send like a Shopee. They will say, okay, you're a loyal customer, so you have a redemption point that you can redeem. There's an award for you. So in order to do this, you need to click this particular link and validate, provide your card details. So there you goes. Similar to what I explained earlier. When you click to the particular, they will give you a link. Basically, they give you a link. When you click to the link, then you'll bring to the fake website. The same thing all over again happens. All right. So please look up. These are the 3 type of main scams that I would say that happen through social engineering. Okay. All right. So now the next I would like to touch point here is a quick one is on the APK file. What is APK file? So today APK file stands for Android package file. So this is mainly happen on the Android phones. Okay, I would say mainly on the Android phone. Those, I think most of people using Android phone, right? So what happens here is they will give you a link, similar like what I mentioned just now. They give you a link, all right? It can be in various type of attempt. As I mentioned, right? They can impersonate as many type of organization or entity, right? They interact with you, all right? For example, they purchase, they promote some product, all right? And they say in order to purchase this particular product within this particular limited time, you need to click this link and you need to do the purchase. So actually, the link they give you is a Android package file. When you click particular link, right, what happened? They insert the virus. What virus is? Malware. Yes, this is called malware virus. They insert the malware virus by you downloading that app, right, to your phone, right? By the link is actually the virus is inserted into your phone. So what happens here? Basically, they are take a remote of your phone. They'll be able to see all the messages that you receive. If you save, for example, bank account details, right, they'll be able to see. That's why today we say, don't save your bank account details. Don't save your password, your bank details, you know. username, password, all in the mobile. It's not safe. All right, and no safe anymore. Unless you are very careful, you're not the type of, click to any link easily, right? Then okay, you can do that. But other than that, if you save it and this kind of things happen, when you click to the link, the virus into your phone ready, that's it. They'll be able to see. They can steal your information. So that is where some customers, they say, hey, I never receive OTP. I never give away my information. How can my money from the bank account is lost? So this is where a lot of people in the public, right, they start to question, right? I never give away my account. Like earlier scenarios, it's very clear they give away the username and password and all that, right? But here, they are not, all right? So please be careful on this APK file fraud attempts. Next is a Macau scam. So Macau scam is basically the phishing that, wishing the scam that via call, all right? Part-time job. So we have sort of seen cases where part-time job, they offer via Facebook. So basically, they get their attraction, all right? This is easy money, all right? You can get earn extra money. So by just transferring some with a very minimal capital, and they will pay you. Initially, they will pay you with whenever they ask you to transfer. For example, ask you to transfer 1,000. You transfer 1,000 easily, you can get 20%, 30%, all right? So then they will transfer. They will give you back the interest, and then later they ask for the bigger amount. So when you try to transfer the bigger amount, so that's where you get into the trap, all right? So that's on the part-time job, and BEC basically stands for Business Email Compromise. Okay, so that's where mostly on the corporate side, right? They intercept the email of the company directors and give instruction to the secretary as though that the instructions coming from the boss, and transfer the money to an individual account. So that sort of fraud also we are seeing. So that's more into companies, okay? All right, another one is personal loan scam. Here you have to look out for personal loan scam. So this is where a lot of public people, poor people actually get trapped, right? So they offer a loan via, Facebook, all right? They promote themselves as an agent of the bank, all right? They say, never mind, your blacklist also never mind, easily can get loan, all right? So what you need to do is you just follow the instruction they give, all right? They ask for your personal documents, and once you give your personal information, right, they say your loan is approved. They send you a message. So they interact all this via, WhatsApp. From Facebook, then switch to WhatsApp, and then they will ask you to give the documents. Once you give the documents, they say you have to pay a down. It's like a processing fee. Normally, bank won't ask processing fee. If you really deal with the bank will never ask you processing fee. Any processing fee, it will be deducted from the loan amount disbursement. But here, they will ask you to pay upfront the processing fee. All right. So please look out for this. So any personal loan, if you want to apply, please either walk into the bank or you meet the person. All right. You check with them whether they are really a bank staff or not. Don't do anything via WhatsApp or email, without we are seeing face to face, all right, as much as possible. Yeah, that's on the personal loan scam, all right. So if you fail to any scam, or if you suspect anything about scam, please contact CCID Scam Response Center. So this is the police response center. You can take a picture if you want to, all right. Immediately you can connect to them, and they will guide you, all right, what to do, what are the steps that you need to do. So the police will guide you, all right? And please also be aware of mule account scams. Okay, mule account here we're talking about, that's not, I'm talking from the perspective of you being a victim. Here you're talking about you borrowing your account to a third party. Because scam won't happen without these two angles. One is you give away your information, you become a victim. On the other hand is you are borrowing your account for the illegal activities. So they will pay you commission. So there's also a way of how the process, the scammers today, they're moving. All right, so please be careful. It's easy money from your account when you borrow, because it's easily can get money and all commissions, but it's in the eye of law, it's a wrongdoing. Okay, if you get caught, you'll be punished. All right, so please be careful of this, all right, on mule account. And you can also go to the HTTPS SEMA Mule account. So if you suspect any accounts, you can go to this particular website. You can check, all right, whether the particular account is involved on the Mule activity. Okay, thank you. Is any question from anyone? I can take a question.
I'm just curious, if for victims of scams, so whether it's a phishing or whatever those scam methods, if the money is lost, what are the chances of getting that money back? You know, if I accidentally keyed an OTP account, and then, I mean, is that goodbye then? And, well, expensive lesson. Is that how it is then?
I think. Okay, I think that's a very good question. Okay, so today, if we see once a scam attempts happen, right, the victim lost the money, right, money transfer out from the account. So where this money goes, all right, as I mentioned, this money goes to the mule account. We call it a mule account, where on the other side, a party borrowing the account, right. So now, in an actual scenario, when the victim realizes this, right, it will take, based on our case study, okay, we have seen the fastest escalation that comes from the victim is within about 10 minutes, 10 to 20, because when the victim, by the time they realize, right, they need to digest first, right, what has actually happened, because they are in a panic situation already, right. So the moment they digest themselves, and then they call the bank, they try to get the number, they call the bank, and the bank, when they got the call, right, what they will do is immediately they will block the particular account of the particular victim, right, to safeguard the victim's account from further damage. That's number one, action number one. Action number two is we will try to see where this money goes, to which bank, all right. It can be within the bank or it can be another bank, but most of the cases that we have seen, the money goes to another bank, all right. So what happened here is, by the time we connect to the other party, for example, from Standard Chartered Bank, now the money go to Maybank, all right. So by the time we reach out to Maybank, in most of the time, the money is either withdrawn, immediately withdrawn by the account holder, okay, which is the mule account holder, which as I mentioned, right, they work on a commission basis, or they will transfer to another account. So it will go on the multi-level layer. So that's why we call it layering of funds, lah. And it happens very fast because instant transfer. Through instant transfer, you all have experience, right? The moment you press enter, the moment you put your username, password, your OTP, you enter, you put amount, everything, you verify everything, confirm, money is out from the account. So this is how the fund is actually being transferred from one account to another. So go back to the question. So we have seen in the past, okay, we do manage to recover some. In some cases, we manage to recover. But most of the time, I would say, most of the cases, because of the time consuming, right? By the time we get the case escalation from the victim, and by the time we reach out to the particular account, receiving party, the money is gone. So in most of the cases, I said, the chances are very slim of getting back the money. Any other question?
Okay, I personally was the victim, and the problem has still not been resolved, lah. So now I've escalated to the bank's customer service, the manager. So one question which I'm still puzzled with is, the account was taken over, all right? But the OTP, how does he get the OTP when I did not reveal to him? Because the OTP is sent to the registered mobile number. So my question is, how did he get the OTP? And when I checked with the bank, he says that, oh, the OTP was sent to my phone. But it was sent very late, because how I trace it back is, the time I received the OTP, that time it already triggered me that this is a scam. So how did he on earth get that OTP number and have it transferred?
Okay, thanks for the question. I think that's a very good question. So as I explained earlier, right, on the APK file, Android package file, right? So the link that basically that you're interacting with a scammer, right? Without realizing it's a scammer, you are interacting with them. And when you click to the particular link and you download that particular apps or website that you go in, right? So it's also content of that particular what I call malware virus. So what happens here, the OTP, all right, that the bank sent to your, there's two scenarios, okay? The first scenario is where the bank sent the OTP to the particular registered mobile number. So now what happened, the fraudster is very smart, the way they're doing it. They go much faster. The moment they see the OTP, right, they take the OTP and they delete the message. So when they delete the message, the user, right, the victim, right, they themselves, they don't know that, you know, that there was SMS OTP that's sent by the bank and it was deleted. It's that fast. That's why I say the malware virus today is very, very dangerous. It's the way their reaction from the scammers is very fast. The moment they see, they take the OTP, they delete it. So in most of the cases, as what Madam has mentioned just now, right? So when we investigate, this is where we found out the OTP actually was sent and it was deleted. All right, so they can go to that kind of extent, you know, by stealing the OTP. Yeah.
Sorry, mine wasn't through a link; it was through a phone call. So, you mean, how could that be?
So if it's if it's a phone call, then I believe if we can recap back, there will be a scenario where they request you to log into the any website. No, and provide the information, or they ask to, to forward any message that you have received.
No, I didn't at all, because what triggered me was a scam. Was when I received the tag. Sorry, it was a case where halfway through a conversation, he asked me for some OTP. Then I said, hey, how do I know you are actually from Bank Negara? You know? So that triggered me and I put down the phone, and that's when the first bank account that I gave to him, he asked me to enable the device, to link it to him. So he was able to actually his own device. So it was, what do you call it? App enabled.
Okay. That's another interesting part. The bank also allowed customers, besides OTP authentication, right? They are to do a mobile app. Today, you see most of the banks allowed to do mobile application, right? So mobile application where you use soft token, we call it token, where you don't need to key in the 6-digit OTP, where the bank needs to, create for you. All right. So this is where you just receive what I call a notification. You just need to press approve, proceed. So that's one way of doing authentication. So what happens is this authentication basically only allowed for one particular device. Okay, so now the fraudsters are also smart enough to know the bank have this control. You need to convince the victim, right, to enable the other be able to register using their device. So when you enable your site, right, so then they try to log in using their site token. So now the soft token is created already, right? No more OTP. No more OTP is required because all the authentication will be done via that particular mobile app with that particular new device that they have registered.
So you mean they took over the account via the app and the OTP is sent to them?
Yeah, so as I mentioned, once a soft token is kicks in, right, so no more OTP already. So you have received the first round, so that OTP for that to enable the first device, and then they will register a new device your account, where they already take away your account, and thereafter they will proceed with unauthorized transaction token authentication.
But the question is, even if they are enabled, the bank would usually send an SMS to say that, did you approve this transaction to the registered mail? I mean registered mobile, but I didn't get that. I got a note to say that he has added himself as a favorite, right? So even if added as a favorite, it will also be sent to the registered mobile. So I would have picked it up already.
Okay. So yeah. So I say it could be in many scenarios, I would say it. All right. So probably on that particular case, you need to go back to that particular bank that that incident happened, right? Probably they will be able to assist to give you more info. All right. Okay. Thanks. Any other questions?
They be able to do anything more than that without asking even for the OTP? They've got the bank details and, can they communicate with the bank?
Okay. Is that a question? Okay, thanks. Okay, so with just the bank account number, the fraudsters not be able to perform any unauthorized transaction. Because as I mentioned earlier, right, the bank's securities are pretty much very tight. All right, they have a multiple layer of authentication. For example, as I mentioned, right, the image, you need to confirm, and then you have OTP, and then now it's soft token already. So all this must be go through successfully on the authentication. Then only they be able to do the view the account, and they want to make any attempt to transfer. So again, with just account name of the bank and just account number, they're not able to do. So they need more information. Yeah.
Can I since I'm organizing, use the chair's prerogative to ask the last question? I mean,
sure.
I don't know about you lah. I was very depressed listening to all that lah. It's macam kena scam at some point lah. It's not will I or not lah. It's when lah. But maybe you could leave us with something a bit more hopeful. What can we do? What can the banks do? What can legislation do to safeguard us from this lah? Because the scammers are always 1 step, 2 steps, 3 steps ahead of us. No matter how careful we are lah, kan, it seems like, okay, just take my money lah, just take lah. So can you leave us on a more hopeful note that this is something that we can win against? Thank you.
Sure, thanks. Okay, to wrap up the session, right? Okay, so key steps that I would like to reiterate here, okay, on how to prevent from such scam attempts, right? So always remember, okay, do not give away your account details to anybody, all right? Let it be the person called, said, I'm from Bank Negara, or I'm from the police, right? I want to do investigation, or tax department. So today you always must remember, tax department will not call an individual, okay, for investigation. Police won't just call over the phone and ask you for bank account details, all right? Or the Bank Negara, they themselves, right? They won't individually, call individual customers and ask this kind of information. And even for banks, all right? So I would just want to remind, sometimes banks do call for transaction verification, right? I think most of you have received calls from the bank. They would like to verify the transaction. Even if you can remember during the conversation, they won't ask for your full account details, right? Because the bank's calling you, right? Basically, the information they ask you to do verification only the last digit of your IC number. They won't even ask your full IC number, all right? They will call you, they will address you by your full name, and they will introduce themselves. They're from the bank, all right? And they will ask for because they want to ensure they talk to the right party. So they only ask for the last four digit of the IC number, and they will mention the particular transaction, whether you have performed or not. So this is what exactly the bank, if they genuine case where they interact, all right? That's from the bank, from the individual banks. Bank Negara, never call anybody. Please take note. Bank Negara Malaysia, okay? I think Zul is here also. He also can confirm on that. So today, Bank Negara will never call any individual for any purpose, All right? If the bank negara want to investigate something on you individually, they will reach out to your bank. They know which bank that you're having account, so that particular bank will reach out to you. All right? So that's how the interaction comes from central bank. Police, as I mentioned, if the police want to conduct any investigation, PDRM always call you to the police station. They will ask you to walk into the police station to see face to face the IO. IO means investigation officer, right? They never call over the phone and ask you to provide information over the phone, especially your personal details. So if such attempts comes, please do not entertain. Just hang up the phone. Do not afraid. Just hang up the phone. All right? Same goes to tax department, mahkamah. All right? Mahkamah won't call individual. If they serve you any summon for whatever offense, right? They'll ask you to walk in. The worst come to worst, what happened? They will blacklist you, right? Am I right? I mean, that's what really happened, right? If you never pay, for example, you never pay for any borrowings or any summons you did not pay, they'll blacklist you. So they won't ask for your personal account information for investigation purpose and so forth. All right, so be careful. Do not give away your information. That's number one, key point. All right, and secondly is link, hyperlink. All right. So today, of course, the banks, of course, with the guidance of Bank Negara, the banks are working towards it that we try to minimize as much as possible sending hyperlink, what do you call, communication to the customers. So please careful, if you ever receive any hyperlink, do not click to the link to perform any action. Right? Let it be any entity. They may come not only as from bank, they will mention, as I mentioned, Shopee, for example. You're a loyal customer of Shopee, they said, please want to redeem your points, please click to this link and validate. If really a legitimate Shopee try to reach out to you, right, they know your details because you are their loyal customer, right? They know where to credit your points. So they won't ask for such information by ask you to click to the link. So keyword here, hyperlink. Do not click to any hyperlink. All right? And of course, as I mentioned again, you do not supposed to reveal your account information to anybody, any third party. Okay, if you want to confirm anything, please walk into the particular, for example, banks, you can walk into the bank, if you want to confirm anything, or even they say from the police, right? So you can walk into any nearby police station to confirm whether such things actually happen or not on you. So just be very careful. So this is how together we can combat, mitigate all these fraud scams. All right, with that, I'd like to thank everybody for giving me this opportunity. Thank you very much.
Okay, thank you very much, Mr. Chandrasekaran. Well, my father was also a victim of scam, but rather his identity was stolen through APK file where they actually impersonated his WhatsApp. And he started asking people for money. So that's also, I suppose, one of the financial scams that we should all be aware of. So that wraps up our event today. We hope that you enjoyed all the talks that we have today, and may the lessons we learned from today benefit ourselves and the community. On behalf of the organizers, I would like to apologize for any shortcomings. Thank you again on behalf of the Geriatric Medicine Unit, and our heartfelt appreciation to Bayer for your generous support to make today's event a success. So don't forget to check out the exhibition booths at Plaza PPM ground floor. We are also providing some lunch for everyone to have. It's a pre-packed lunch. You can bring it elsewhere to eat. Assalamualaikum warahmatullahi wabarakatuh, and have a fantastic day. Thank you.